has started.
Good morning. Welcome this morning to our February the 8th, 2021, finally 2021, Child Care Commission meeting. I am Zach Everhart, the chair, and we are going to go through some housekeeping things here this morning, and then we'll get started on our welcome. And one thing I wanted to say this morning was we were having a planning session for this meeting, and I guess it just kind of came up during that meeting that it is now officially, as of this February meeting, been a year since we all sat in a room together and had a Child Care Commission meeting. And I really miss that. I appreciate the fact that we've been able to get through meetings with this platform, but I know it's not the most effective way to do it, and really miss seeing you guys, and also miss the conversation around the table, so to speak. So hard to believe, but all that being said, I do want to really give a shout out, if you will, to all the child care providers, workers, DCDEE, all the healthcare people. I'm not even going to start naming everyone, but just thank you for the endurance that we've given and the persistence to get through this past year. I think our children have had the safest and best experience they could with what we've been dealing with. So thanks to everyone that's been a part of that. So to get through some housekeeping this morning, commission members, please announce your presence when the roll is called. And this helps with taking notes and minutes. DCDEE staff will complete motion forms as needed. I need to note the ethics statement at the bottom of the agenda, so I'm going to go ahead and do that while hopefully everyone's getting ready and not having to listen to this one more time. But here we go. It is the duty of every commission member to avoid both conflicts of interest and appearances of conflict. Does any commission member have any known conflict of interest or appearance of conflict with respect to any matters coming before the commission today? If so, please identify the conflict or appearance of conflict and refrain from any undue participation in the particular matter involved. So today we'll have a chairperson's report, which not too much there, one bullet point on some minutes. We will have a roll call. We'll have Ariel will give us a director's report. There'll be an update on the CCDF focus groups that Laura will give us. There'll be a brief rules update from Deidre. Christy and Ariel will give us a presentation on the COVID-19 vaccine. I'm interested to hear this. So from what I understand, it's very thorough as well. So that'll be great. We will have a public hearing on rules 28 and 3013 beginning at 12 p.m. General public comments will also be accepted at this time. What we've done here is put in our public hearing and public comment both at the same time at 12 o'clock. We will recognize if there are 30 minutes of each conversation to be had, we will allow that time, but if not, and there's not that many folks commenting during that period, we'll just kind of consolidate them both into that 30-minute window. But just for the record, both groups will have 30 minutes allotted. Whether it's simultaneous or apart, we will figure that out later. Hopefully, we can get on through that and not have too much waste of time there. Let's see. The rulemaking discussion, basically, and we'll get into this further, Deidre will help lead us through this, but the commission needs to decide if it wants to move forward with making the temporary COVID rules permanent, which those were the 4 rules that you guys remember we worked on a lot back during the fall. If the rules do not go through permanent rulemaking and submitted to RRC by August 13th, they will expire. So we can get in further on that, but we need to basically just come up with a timeline and what our intent is there as far as moving forward. And we'll get as I said, we'll get deeper into that this afternoon. And the public hearing will be held on proposed rule amendments, as I mentioned, 2828 and 3013 and its fiscal note. And we'll get further into those at 12 o'clock as well. So that's all the notes that I really have here. Just as we've said for a year now, unfortunately, please mute if you're not speaking. And again, just let Rachel know whom you are if you need to speak. It gets very difficult. I know we've done this a lot, and I think we've gotten a lot better at it. But with the chat rooms and the Q&A rooms and the text and the emails and people raising their hands, it's easy to get lost in here. So if you'll just speak who you are, that would be so much easier for everyone. So,
Hey,
all right.
Zach, may I ask a question?
Yes, ma'am.
Do we have time, or we have time set aside for discussion of the fiscal note as commission members?
We don't particularly. Let's see how time goes. Ariel, I've had this feeling that there's going to be some, I'm sorry, Amelie. I'm looking at one sheet and there we go, how I get lost here.
Okay.
Amelie, let's see how that goes, but I think there certainly could be. If not, there definitely will be before these rules are taken up.
Okay. I just have some questions, and
certainly.
So thank you.
But if it's not today, there absolutely will be before we say aye on anything.
Okay. Thank you.
Absolutely. All right. PG, you want to give us a roll call, please?
Okay. Zach Everhart.
I'm here.
Rhonda Rivers.
Here. Here.
Sharissa Blanchard.
Here.
Melissa Burrows.
Here.
Susan Butler Staub.
Here.
Brooke Childs.
Here.
Victor Cossenberry. Lanier DeGrella. Sharon Foster.
Here.
Elizabeth Gilliland. Elizabeth, can you hear me?
She's not at her desk right now, but she is logged in.
Okay. Mitchell Gold.
Here.
Kimberly McClure.
Oh, sorry, here.
Perry Melton.
Here.
Beth Messersmith.
Here.
Amelie Scholl.
Here.
Ioma Inuka Thompson.
Here.
Janie Truesdale.
Here.
And Victor, are you here? Are you present? Let me check the attendee list.
You have a quorum, Mr. Chair.
Thank you, John. And yep, okay, I was going to say, Ioma, looks like you got in. When we can hear your voice, we know you got in, so welcome. All right, so we do have a quorum, and we did have a note from Dr. Lanier DeGrella that notified she will not be in attendance today. So thank you for that note. All right, moving on to the chairperson's report. Don't have much here on the agenda other than the approval of the December 7th, 2020 second quarter minutes. They were disseminated previously. Did anyone have any questions on those? Any comments or corrections? Okay. Hearing none, I'll welcome a motion to approve these minutes.
Perry Melton, I'll make a motion to approve the minutes of the meeting.
Thank you, Perry.
Beth Messersmith seconds.
Thanks, Beth. Any more discussion on the approval of December 7th, 2020 minutes? All those in favor indicate by saying aye.
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 Anyone opposed? All right, the December 7th minutes have passed. Thank you. And Perry, not a big deal, but I could barely hear you when you were speaking right there. So if you need to speak again, I know you don't have a problem getting in.
Can you hear me now? Is that
That's
better?
a little better, but it's not fantastic. But yeah, that's definitely a little better. Thank you, Perry. Okay. Director's report from Ariel Ford. What's happening these days at DCDEE, Ariel?
Well, thanks for asking, Zach. Thanks, everybody, for having us here and for allowing us some time to speak about the efforts moving forward in the division and with partners. Before I begin, I do just want to say Happy Black History Month. If anybody is looking for resources, I've been particularly excited about things that I've found on the NAEYC website. If you're a member, I think there's some stuff that's public facing too. On the National Black Child Development Institute, there's some great stuff there, and on the Council for Professional Recognition. So those are 3 websites that I have been studying so that I can further my knowledge about how we support Black children in our classrooms and how we bring racial justice to our early childhood system, and about the contributions of African American, particularly women, on early childhood. So I just wanted to start by recognizing those 3 websites and recognizing the really amazing months that we're in. And I'll move forward. So thank you for being here, everyone, both commission and our participants. The things that we'll be talking about some today are just some COVID-19 updates to share. We have some not quite final, but close to final numbers about the expenditures and the ways that the field has responded, activity updates, child care rules flexibility updates, and then some legislative updates. So we'll go through each of those. And please, as normal, ask questions along the way or at any point or at the end. We are here to try to clarify and provide transparency for all of the work that we're doing. Without further ado, we'll talk about COVID-19. As you know, we still are in the pandemic. The vaccine is rolling out slowly, but I did want to share some work that has happened and some just kind of data points that we've been collecting. So I wanted to give this overview slide to show where we were before COVID-19 in our child care ecosystem, and then to show kind of the progression. So as you can see, in February, or before COVID-19, we had about 265,000 children in licensed care, with about 25% of those receiving subsidies. And we had, just under 6,000 licensed child care facilities open, with a workforce of about 41,000. In April, if you'll remember, this was during the stay-at-home orders, and child care was being provided only for children of essential workers. So we expected that there would be a great decline in the number of children served, the number of staff in open programs. But as you can see, in April, we saw only about half of our centers open. Most of our homes stayed open, and I think for any homes out there, you are the unsung heroes of the pandemic, really staying open and supporting families throughout. We are having a slower return, and I don't think this is a surprise to anyone, certainly not anyone who is in the field. As of December, we had about 150,000 children open in regulated care. Almost all of the children receiving subsidy are back in regulated care, so that is, I think, Christy might have the number off the top of her head, but I think it's about 94 or 95% of children receiving subsidy are back in care. And we do have almost all of our centers and homes open, with a large portion of our teachers and staff returning to work. There was a question last week about why, if there are so many fewer children, why that we have so many open programs and staff. And the thing is that with updated protocols for cleaning and health and safety, that does require extra staff. We also see programs having to have teachers quarantined when they have had an exposure, and so there is a need for overlapping staff there. So despite the reduction of children in care, we know that there is still a huge need for retaining all of our workforce.
Ariel, this is
Yes,
Christy. Just to give you those numbers, yes, subsidy for 0 to 5 are 95% as of January. are back. And a total for school age, there's only about 92%, but total we're at 94%. And our waiting list has increased almost 2,500 from December to January. So we're starting to see people being placed on the waiting list again.
Okay. Thank you, Christy. Yeah. So we can see that folks are coming back into licensed care. We continue to see those numbers rising, and we will see those maybe slower at first, but as the vaccine continues to roll out, we expect the numbers of children in licensed care to continue to rise, and we have no reason to believe that the number won't move back toward what it was pre-COVID over the course of the year. So just to give another slide that kind of visually shows the efforts that not just the division, but our entire child care system put forward to maintain our field and to support the health and safety of children and families in our workforce. This kind of is a snapshot overview of our COVID-19 interventions across the state. So under health and safety, you might remember that we have our toolkit, our public health or child care public health toolkit that is updated monthly to make sure that we are providing them with up-to-date resources for our child care facilities. And I think I might have mentioned this last time we were together, but when we are waiting for final approval of the toolkit or something like that, we'll start to get emails from providers saying, "When's the update? I'm waiting for the update," which I think really is a testament to how that toolkit becomes a trusted place for our child care providers to look for the best health and safety guidance. So many thanks to all of the hardworking folks both at DCDEE and on our COVID-19 response team at the department for helping to make sure that happens. We were able to expand the reach of our child care health consultants to reach all 100 counties. That had been a more locally funded investment. And with the pandemic, we recognized the need for full state spread of that program. So that is another effort. Communication of webinars to make sure that folks knew the plan around the closure, around the emergency, and around the reopening guidelines. And then, as y'all know, PPE went out to all open child care programs in the summer and then again this winter. So those are the health and safety measures that we're taking. For access and affordability, we are proud to have partnered with the CCR and our system to launch an emergency hotline for our child care programs, and that has been really successful. We want to give special thanks to CCR and R for standing that up, I think within 24 hours is what I have been told, so thank you for that partnership. We also are grateful to have been able to cover the co-pays for families who are receiving subsidy and for from April through August, and then also from April through continuing now, we have been providing subsidy for school age care who are in remote learning at child care programs. We have covered 100% of that because our child care programs are not doing after school right now. They are doing full day remote learning supports plus after school. So wanted to make sure that that was there. And then, as you know, there was the emergency family support program for essential workers that served about 17,000 children in April and about 19,000 children in May. And that was during the stay-at-home orders to make sure that the essential frontline workers had care while they continued to make sure that our hospitals were open, that our gas stations were open, et cetera. So thank you for that. And then, as we've talked about in this group many times, the emergency school age remote learning program served about 7,700 children in remote learning in October and November of this year. Operational support. We've talked a lot about the operational grants. So we had operational grants that happened April through October, serving about 4,200 programs over that time. That was for open programs who were not publicly funded programs. Subsidy stabilization for all programs in April and May, and for programs that were open in June through August. So that's where we paid the full amount of subsidy regardless of child attendance, knowing that families were really trying to work out what the best situation for their children were during those months. We moved back to our typical subsidy process in September. And then we have provided NC Pre-K stabilization from March through this current year. So that program is stabilized. We're able to continue serving children in that program. The workforce support, I think this is one that we don't talk about enough. We did launch the Hope for Healers mental health helpline. We know that this pandemic has taken a huge toll on mental health across our country, and our child care providers and our healthcare workers have experienced unbelievable stress and worry over the course of this time. So that's been a support that we were able to engage in for our child care community. And then we have also talked about the bonus payments for our teachers. There was a set that went out in April and May and one in November and December, recognizing they have been acting as frontline workers, and basically created a kind of time and a half pay for them. Along with that, we provided a 10% administrative overhead payment for the child care providers as they put that into the rule. So that's a ton of work that happened across our entire system, for the division, for our community partners, for our systems agencies, and for you as child care providers too. And I think it is, I don't know how we could not recognize all this work. While we are still in very difficult times, I know that our system is stronger for our collaboration and our work together. Here's a little bit about how these fundings to provide all the work for those efforts happen. So it's broken down into kind of a March through June, and then July through current day. So on the state fiscal year 1920, you can see that the largest share of funds went to operational grants. There was money for parent fees, for the pandemic child care payments, and for the bonuses. And then on state fiscal year 2021, you can see again that the operational grants are the largest share of that funding, with the other pieces, the other kinds of system supports rounding out the rest of that expenditures. All total, between all funding streams that we were able to access, and this is an estimate, this is a working summary because we know we still have some receipts coming in, but we have expended almost $290 million on pandemic-related expenditures. And I think this just shows how vital childcare is to our entire state's economy, that we were able to really put that much funding to stabilizing the system. We know that it's not enough. We know that programs are still really struggling to make ends meet and to stay open, and we are working to make sure that funds continue to flow to you. But I did want to show an overview of where we are, the working summary, and the kinds of efforts that were put forward over the course of the last 11 months. Moving on to some activity updates. We had mentioned, I think in the last meeting, that we are doing a survey of childcare providers, and we are really looking to do a snapshot to kind of see where programs are today, where, especially in relationship to subsidy versus private pay. And so this survey, the letters were mailed out at the beginning of the year, and we will have a summarization and response by spring. So we will bring this back to you as we know more, but just wanted to share that is ongoing, and that this is a reminder, if you're a child care program and you have not filled out your survey, please go ahead and fill that out. We want to make sure that your voice is heard and that we can learn from you and with you. Our GCDEE communications, you can see from this list that we continue to communicate regularly about pandemic-related updates, as well as our ongoing efforts around our child care development plan and professional development. So we continue to try to stay in regular contact with our child care community and our partner community You'll start seeing more communications around vaccines. You'll start seeing more communications around the CCDF focus groups, but we will not stop communicating around pandemic-related effort just because we are still in the pandemic and we want to make sure that our provider community is up to date on what they need to know to stay safe for themselves and their whole community. We mentioned this last time also, and I just wanted to give a status update. So the CCDF monitoring that happened in the summer, we shared with you that we had to write a response to this within 60 days. We did ask for a short extension because the 60 days mostly fell across the holidays, which it was hard to kind of get everybody together with vacations and holiday events. But this is, we are moving quickly toward having the response submitted to our federal agency. The three areas that we had monitoring findings were the first in consumer education. And so this one we shared is about how we are making sure that we are posting all monitoring and inspection reports, and particularly around child maltreatment. We are working alongside our federal partners to understand the exact the most precise way that they want us to move forward with this. We are working with them to look at other state websites to make sure that we are meeting their requirements while also staying within our state legislative mandates. So we are working with our legal counsel, with our federal support team, and the licensing team is working really hard on this. So stay tuned for updates about that, but that is in process. This one I'm kind of excited about, the second bullet point, the 12-month eligibility determination and redetermination. So the way that we had interpreted this guidance was a little bit more stringent than they had intended it to be. And so we are making changes to our procedures to make sure that time-limited changes in a family's status does not impact their subsidy. I think this is a great thing. It means that families have more stability around their subsidy eligibility, and that we're able really to support them through kind of the ups and downs that take place in life that should not make the difference in whether or not they are able to access childcare. So I think that is really wonderful, and I'm grateful to our federal partners that they clarified that for us. And then the third is something that we will come back and ask your help around, and that will be in our plan. We flagged this for you last time, that particularly for our GS1-2 program, that they have asked us to clarify more rigorously around child abuse, head trauma, maltreatment, to make sure that those standards are crystal clear. So we will come back to you with a request that you work alongside us to meet that monitoring requirement. But I did want to give a follow-up since we had shared that with you last time. And now I'm going to pass this over to Christy for the child care rule flexibility update. She will walk through the next few slides with you. Christy?
Sure. Good morning, everyone. Just wanted to talk briefly to you about some updates in our child care rule and requirement flexibilities. I think you're all aware that way back in April and May, we put some flexibilities in place to help child care providers as they were facing this pandemic in their facilities. And while North Carolina continues to remain in phase 3 of reopening, we still have flexibility with some of the child care rules and requirements. They're going to continue as outlined, and previously, many of them will continue as outlined previously, but there are some amendments on a few, and I just wanted to touch base on these for you. There are a few things that have been reinstated or will be reinstated by March 1st of 2021. And when I say reinstated, what I mean is that there is no longer going to be flexibility for compliance with these child care requirements. And I think they'll make sense as we go through them. I think most of you are aware that We began inspections back in September, and as we began these annual compliance monitoring visits, we adjusted our time that's in the classroom. We want to make sure that we're following health and safety requirements, and so we're limiting the amount of time that our child care consultants are in any of the classrooms, and we spend most of the time very socially distant, having conversations with the administrators at the facility. As we've done this, we have, been able to do a lot of technical assistance and support for child care providers around health and safety, and that was one of the main reasons that we wanted to go back into the centers so that we could provide that support. A couple of other things that will be reinstated as of March 1st, the SIDS training. We are no longer going to need flexibility for additional time to complete this training because right now we are offering this temporarily in a virtual format. So we should, most child care providers, any of them that are needing this training should be able to access this in some type of virtual format. And then the other flexibility that has been in place that we are now going back to our normal operating procedures with our child care rules and regulations are the child's health assessment and child immunization records, both for homes and centers. This flexibility we do not believe is any longer needed to give additional time for families to submit this documentation. The child care requirements already allow families 30 days within 30 days of enrollment. So the Division of Public Health had previously allowed an extension of temporary suspension of these immunization and health assessment requirements, but that has expired as of December 30th, 2020, and so we're trying to get back in line because they're requiring it, then we also need to make sure that we have those files on site at our child care facilities within 30 days. So we have allowed, by implementing this March 1st, there's been 90 more days given for child care providers to collect any that they need, but we will be reinstating that as of March 1st. So let's move on to the next slide, Ariel. There are some flexibilities, though, will remain in effect for ongoing requirements for a license, for NC pre-K attendance, staff qualifications, daily operations for family child care homes, and nutritional requirements. So let me speak briefly to these. If you think about the ongoing requirements for a license, basically the division will not enforce required inspections like environmental health and other type of inspections if they're not able to be done in the local community. We know that many of our health departments are extremely overtaxed at the present time, really getting the vaccine out, and we do not want to put any undue burden on if you were supposed to have these inspections and they just can't happen. So that flexibility will remain in effect. Also, under staff qualifications, new staff, they have to have medical reports and TB skin tests. We are going to allow that to continue to be temporarily waived to allow staff to begin work, provided that they are not symptomatic and all the requirements can be completed within 60 days. So there's still flexibility there for child care providers in that arena. And also temporarily waiving the requirements to maintain information in an individual staff file. So there's still some flexibilities. All of those flexibilities are still in place of the ones I just talked about around the ongoing requirements for a license. There's also flexibilities in place for nutritional requirements. The bottom bullet, we have had in effect the temporary waiver for the requirements to provide additional food to meet the USDA meal patterns for child care requirements when meals and snacks are brought from home. So we're still allowing that in centers as well as in homes. So just wanted to let you know that that's still in effect. And then also the second bullet, NC pre-K attendance. We have waived the requirement. There is a requirement that if there are 3 consecutive days missed, then they have to reach out to the family. As long as we know, and if it's COVID related, that and the way that attendance is, many of our pre-K classrooms are being taught in a hybrid format. Some are still completely virtual in our school system. So we realize that that requirement is not necessary. I will tell you right now that what we've seen in our NC pre-K classrooms is that we have better and greater communication with our families than we've ever had before. So I feel like that by keeping this in effect, we are continuing to interact with our families and really know what's going on with those children and families. As far as the family child care homes, we talked about the USDA meal patterns that will continue to be waived. And also, we're temporarily allowing unlimited screen time usage for school-aged children when working on school assignments. We can move on to the next. And then there's a few of our rules that have been, had some flexibility since the beginning of the pandemic that we've amended slightly. So those are listed here on the screen for you. Staff orientation, as of March 1st, we are amending the time frame. I think originally we said we were just temporarily, we were giving more time, given an extension. Now we're going to limit the time of that extension, which is going to be 8 weeks. And the reason is, there is so much important information covered in that orientation, and I'm sure many of our providers were doing it anyway. So as of any child care provider that has hired new staff after March 1st of 2020 through December, they should have completed the orientation by now. But if not, they must show that they will complete it within 8 weeks. So beginning March 1st, anybody hired after March 1st of 2021, you will have up to 8 weeks to complete the staff orientation. Also, our training requirements, we had originally provided some flexibility here. We're going to continue to provide some flexibility, but I do want to just mention a few things. We are going to provide 6 months for administrators and any child care provider to complete and or renew their CPR first aid certification. However, this flexibility will only be allowed if at least one person on site when children are there has a current CPR and first aid certification. We have to have child care providers that have current certifications, so if there is an emergency, that can be taken care of. We're also amending the flexibility for playground safety, IFSID, and emergency preparedness, because all of those are currently offered in a virtual format. And playground safety, normally there's an on-site component that has to be done, but the flexibility is allowed right now that you can complete these via a virtual format. Same thing with the family child care homes. We're going to provide 6 months for operators and any additional caregivers to renew their CPR and first aid. So wanted to mention that. And then the last thing, because we've had a lot of questions about what's going to happen with the rated license. We've had a lot of new programs that have opened, and people are wanting to move forward with getting their first rated license or coming off a temporary license. We are currently working and analyzing how to reintroduce assessments in a safe and healthy manner. And so you'll be hearing more about this in the near future. But right now, we have not finalized those plans, but we are figuring out ways how we might slowly reintroduce this and also give some facilities that are already licensed and maybe coming up for their reassessment, some flexibility, but you'll be hearing more about that in the coming week. But just wanted to let you know that we do hear that, we do understand the need, especially for those new facilities, and we are working on a way that we can begin this process again, but in a health and safety safe way. And so you'll be hearing more information shortly. So Ariel, I am finished, and I'll turn it back over to you.
Thanks, Christy. Legislative update. We are in long session, and just to share with you the leadership within the House and Senate that are on committees who we have most closely impact the division. You can see our House HHS Appropriations Committee, the chairs and the vice chair, and then the House Families, Children, and Aging Policy Committee, the chairs and the vice chair. So we want to thank our House leadership for coming alongside us. It does take our whole system to make child care work in our state. I know that we're all looking forward to working with them over the next year to make sure that we move through the pandemic safely, as well as just continue our normal operations. Similarly, in the Senate, the HHS Appropriations Committee, the chairs and the members you can see here, and again, thank our General Assembly leadership for working alongside us over the next many months to move toward a health and safety reopening. Some important deadlines here. You can see the House and the Senate when public bills drafted, filed, and then crossover is May 13th this year. So those are just dates to kind of keep on our calendars that we will be working toward over the next many months, several months. They come up faster and faster every year, it seems like, but you can see that the Senate happens a little bit faster than the House this year. We are looking for Governor Cooper's budget to come out in March, so I know we are all awaiting the governor's priorities to see what comes in that budget. And then we have heard that there is a lot of interest in getting a more traditional budget passed this season. Last year with the pandemic, there was a mini budget, and just a lot of that was the most unusual year that any of us have ever experienced. But we know that there is more interest in moving back toward a more traditional budget process this year. So I know we're all glad for that. And then just two pieces of proposed legislation to make you aware of. The first is House Bill 29, and this is the verification and immigration status for the SAVE bill. And this is looking to require state agencies to use the Department of Homeland Security's Systematic Alien Verification Entitlements Program. This verifies immigration status for applicants of public benefits, and where this is a little bit nuanced for child care is that it is not the parents who are the recipients of child care subsidy. It is based on the child's immigration status. So we are working to determine how this may or may not impact our child care subsidy program. So just kind of a TBD, but wanted to make you aware of that. And then the second piece of proposed legislation is Senate Bill 37, and this is the in-person learning choice for families. So it's requiring school boards to provide in-person instruction for students enrolled in K-12. So this is important because our pre-K guidance says that if any other children are being served in buildings, then pre-K has to be served. So we know that some of our pre-K classrooms have been remote only or hybrid in our K-12 settings, and so this is going to potentially change the mode of instruction for some of our pre-K classrooms. So that one is pending too, and we have asked all of our pre-K classrooms to have a plan for moving back to in-person learning. So this would not be something that would cause great upheaval. They already have a plan for it, and they're already preparing for the day when they would maybe be able to move back to in-person learning. So that's the other one that might have an impact on some of our programs. Wanted to make you aware of. And that, dear friends, is the end of our director's report. I would be happy to have questions or comments or clarification if anyone has any.
Ariel, this is Perry Melton. I have a question.
Good morning, Perry.
Can you hear me okay?
I can.
Zach said he had trouble hearing me.
I'm better now, Perry, so thank you.
All right. My question was, you went over early in your director's report about the distribution of grant, DSS essential income, and other things. And I have made the state legislature aware and got it to the governor's office, but I just wanted to make sure that DCDE was aware that the DSS essential worker income has had an unintended negative consequence on providers trying to qualify for the third round of PPP. So I didn't know if you guys had any muscle to help with the Department of Revenue, since it was a state ruling for this DSS essential worker, even though it's some federal money tied into it, that money has to be qualified as gross receipts in the qualification process for PPP. Mm-hmm. So for many of our 5,000 providers out there, there is a possibility that it will knock some people out of qualifying for PPP.
Yeah.
Unlike the grant money, that money was basically a pass-through for the state to the child care providers to go directly to the workers, and we received no direct benefit of it other than assisting teachers. So I just wanted to make you aware of that. I didn't know if y'all were aware and anyone could help get a clarification on that ruling through the Department of Revenue so we could exclude that or let our providers know that it can be excluded on their PPP application.
So you're speaking about the operational grant, Terry?
No, I'm talking about the DSS essential worker income.
Okay. No, you know what? I had heard that the operational grants were, but I had not heard that essential worker was. So I'll follow back up on that.
Okay. I'm sorry. You heard what about operational grants? Can you clarify that for me?
The operational grants were being counted as income.
Yeah, and I halfway understand that.
Yeah.
The essential worker income, I think, is according to my research with a few accountants in my accounting firm, and it doesn't affect me personally. I want you to get that on the record. It doesn't change my status at all. But in applying for my application, I discovered this, and I know there's probably a lot of providers who are smaller providers who their accountants are just going by the PPP rules, throwing that revenue in their gross receipts and just tell them they automatically don't qualify. So I would think if DCDE could get us a ruling on that or get us to help NC Department of Revenue to get a ruling on that, it could help some providers qualify for this third round of PPP. That was kind of my observation.
Yeah, thank you for raising that. I had heard it about the operational grants, but I had not specifically heard about the essential worker program. So I will follow back up on that. Thank you, Perry, for raising that up.
Thank you. And I have one more question. This was really an observation for Christy, and I don't want this to be construed as any form of criticism. But I did want to make Christy aware that on my annual inspection, one of my facilities, we did get a violation for sanitation not have fulfilled their requirement to do our inspection, of which we tried to get them out there, and, of course, they were backed up. And it really was a minor thing. I just want to make sure that everybody's on the same page, that the consultants were aware of the flexibility in that rule, because it didn't appear to benefit us in that case. But other than that, they've done a fantastic job.
We'll go back to our licensing consultants. I know Tammy is on, and just make sure that everybody is reminded.
I don't want that to be true as criticism at all. I promise you, y'all have done a fantastic, super job on the annuals, and I couldn't be happier. I just wanted to make sure that in that case, maybe somebody went on the same page or how that rule was applied. I just want to make her aware, because absolutely, positively, you guys have done a super job. So please don't misunderstand that. I'm just kind of letting you know, okay?
Thank you, Perry. I don't take it as criticism. I think we don't know unless somebody shares it with us. So thank you for letting us get better, and we'll just go back to our licensing consultants and just make sure that everybody's on the same page. And we can certainly look into your specific program, and then if we hear from any other providers that they've had that same instance, we'll go back and look into that too. So thank you for raising that up too. I appreciate it.
Thank you, Ariel. Thank you, Christy. Thank you, Zach.
Thanks, Perry. Any other questions?
Go ahead, whoever that is.
It's Sharon, Dr. Foster. I had a couple of observations and some questions. Kudos on getting the immunizations on track. The immunization status in the last year of children had fallen off 40, 50%. It was very worrisome to pediatricians throughout the country. But thank you for going and getting it back on track. Question on the verification of immunization status. I know that illegal immigrants are not allowed to get benefits, but if the children were born in the United States, they're considered U.S. citizens. So would they then be able to receive child subsidy?
That's what we're trying to determine, because we have the same interpretation that the children are the recipients of the benefit. So we are just trying to make sure that we are providing that federal guidance and making sure that it is shared with our General Assembly so that they understand that, and to navigate the legalities of that particular piece of legislation. So you are absolutely correct that our federal guidance is that it is the child's immigration status that is brought to bear on child care subsidy. So that's why that was just kind of a TBD update, that we are working through that, working through the process of clarifying that.
Thank you so much. And the other thing was on I saw the dates, and they're mid-March, that new legislation needs to be introduced. Is this the time that we should bring up that we ought to not be doing any type of corporal punishment to all children, which includes the religious institutions?
If someone wanted to put that forward, this is the time, yes.
Okay.
If the commission wanted to do that, and I'm looking for John and Amber in here too, so.
In 2019, we had 3 or 4 meetings with the commissioners. There was a subset of us, about 6 or 8, and it was the general consensus. This needs to be moved forward, but it requires legislative changes.
Well, you're exactly right, Dr. Foster. We had a subcommittee that was working on that, and then last March hit, and if I'm remembering, and I was not on that subcommittee. I appointed that committee, obviously, but they had done a lot of work in the background, and I think had some stuff that they were working on, and then the pandemic hit, and I think at that moment we knew it was not the right time to even think about it. So if that seems to be something that we could get some leverage on, I am more than happy to let the subcommittee continue their work and see what we can put out. I think it would be great. I don't think there was anyone at that time on this commission that opposed to trying to see if there was something could be done about that.
This is John, if I may.
Sure. Thanks, John.
Just a few things to keep in mind. As individual commissioners, in your individual capacity, you're always welcome to contact the legislature about any matter. The commission, if it votes to go to the legislature with a specific matter, can certainly do that. But the reason I wanted to mention this, first of all, Ariel asked for me to chime in, but I wanted to make sure you all understand for time frame, with whatever you do, whatever you want to go to the legislature, there's usually a crossover date in mid-March to sometimes in April. I want to say it's in March, which means that all legislation has to be passed by at least one branch to have a good chance well, the official rule is to be passed in order to be passed into legislation during this legislative session. Now, I can think of exceptions, and exceptions certainly arise later on to specific items that the legislature wants to pass. But the general, so it's not impossible to get something passed after that crossover date. But the general rule, noting there are exceptions to it, is that a bill must be passed by one branch and sent to the other prior to that date. So I just wanted to mention that in case for whatever you want to ask the legislature for, if anything, to keep that in mind so you don't miss that date.
And there are the dates posted. Thank you, John.
Can I just ask? May. I'm sorry. May. Yeah. I'm sorry. I didn't see that on my. Yeah. It's been March in years past. My apologies.
It was my recollection that we really didn't find any centers that continued to do corporal punishment, and that this would kind of be an easy thing to just codify at this point.
I was not a part of those.
Dr. Foster, or
yeah, the subcommittee would have to answer on that, Mitchell. Thank you.
So this is Elizabeth. So we have not met since before COVID, and I've been drowning with work since then, but I'm at a point where I could actually recall those meetings if the subcommittee wants to get back together. And I think we need to clarify, Zach, who's on that subcommittee at this point, because I think some members have changed and things like that. So
okay.
Could we take a moment to sort of clarify that?
Absolutely. Yeah. Do you have a list of who you think is on that?
I'm kind of out of it. Let's see. I know Sharon and Mitchell were on it, and the Reverend was on it. Of course, he's not on this year.
Sure.
Who else? So I guess
Dr. Thompson was on.
Huh?
My recollection, Dr. Thompson was on.
Mm-hmm.
And Beth Messersmith, I was on.
And Beth, yes.
Would it be possible, Zach, for you to just sort of reappoint the committee and have people who, I think we were trying to keep it to 7. There was some number we had to keep it to, so that it didn't constitute
a quorum.
Yeah, a commission meeting.
You had to keep it at 8 or below with 17 members, so you don't constitute a quorum, or else you've got to follow all those rules about public meetings and public notice and all.
Okay, I'm jotting names right now.
The one other thing I do want to flag is that I think that our next full task commission meeting will be after, this is Beth Messersmith, will be after the bill filing deadline will have had to be. And so I think going ahead and reconvening the task force to have this conversation, and as John said, there are always ways to get things into the legislative process at various points. But I do think that we just need to be aware that by the time that group reconvenes and we come back to this body, that will be after bill drafting.
Thank you, Beth. That's exactly right. I'm thinking this group, if this is something we want, and I certainly think we need to let the subcommittee meet sooner than later and figure out what direction they want to go with things. But you're exactly right. If we're going to do that, I think you guys need to call a meeting fairly quickly, and at least with this new virtual platform we're all used to, it should be a little easier than it was previously. But I've got Mitchell, Elizabeth, Dr. Foster, Beth, Keoma. That's 5. Was there anyone else that was on that list, on that subcommittee, or anyone that desires to be?
So that makes, you have 5, right? 1, 2, 3,
Yep,
4, 5.
that's correct. I have 5.
So if there's 1 or 2 more people who would really want to be on that committee, that would be great to have a couple more people for legwork.
Sure.
I feel like there were a couple of people who wanted to be on it last time who stepped down.
This is Melissa. Hi. I had volunteered previously because I really wanted to work on that, and then we ended up with too many people, so I stepped back. Unfortunately, right now is probably not a great time for me to commit to that.
Oh man, I'd already written your name down too. And you started talking.
Me too. I had already written it down.
No, I understand, Melissa.
No,
Thank you for saying that. No.
If you need a couple of more people, I will certainly participate.
It's okay.
And yes,
Melissa, it's okay. I appreciate it, and we should have picked you the first time, huh? That's our fault, right?
No. Totally fine.
Melissa, would you like to be, because we kind of pulled you in a little bit at the end of the other, would you like to be on the list and sort of be informed of meetings, and if you can come to them, you can, and if not?
I would love that. I would love that, and I would certainly try to do everything I can to help move forward. Yeah.
And let me say, if I may, my statement about exceptions to the crossover and other deadlines, don't assume those will occur. Take these deadlines as hard deadlines. I just was trying to be accurate that I have observed that the legislature does not always follow these with every single thing it does, but I would definitely take these deadlines to be hard deadlines so that you don't miss them.
And we now have a list. There's the list in the chat. Thank you so much, Arletta, for, I guess we dug up some old notes. Thank you.
Thank you so much. And the last thing that I just wanted to bring up, is there any way that it can be shared with us the number of cases of COVID in the different centers and family centers, both in the children and in the caretakers?
That's a great question. To the best of my knowledge, that is what North Carolina is tracking is clusters at the child care level. So we do not get individual reports if someone has a verified case or, a positive. It's one or maybe two cases at a child care program, particularly if they're unlinked. So what we track is the COVID clusters at the child care center and family child care home level.
So does it mean that since there were no clusters, there's no information for us?
Correct.
Okay.
Well, there are clusters. We do have cluster data that we could share, but we do not collect individual positives.
Okay.
Cluster data.
Right. Ariel, this is Christy, Dr. Forrester. The child care rule, any communicable diseases are reported to the health department. And so our child care consultants sometimes get notified, sometimes do not. So we do not have a way to track that information, but the clusters data is available on the DHH website, but we could pull reports for the commission if need be.
I think that would be helpful to see if we need to make any more rules of safety and so forth.
Arletta just put the link to the dashboard for child care clusters in the chat, so that is available publicly, and we can certainly do a little bit of a deeper dive at the next meeting if that's something y'all would want us to do.
Thank you.
Yeah, absolutely.
Ariel, this is Somali. I have a question, and I don't know if you know anything about Senate Bill 37. But it basically, it's putting control of back to school in person really in the hands of the local school boards, and it's giving them the option in K through 12 to go back either A or B. A, of course, is not enforce social distancing, everybody in the class, et cetera, and so forth. Right now, elementary is in A and middle and high is in B. Do you have any sense, I guess this legislation would override the governor's emergency order that's currently in effect, that middle and high would be, and I know it's not in our world, but that middle and high would be overridden by this, or I couldn't get a feel for it.
Yeah, I don't know what the outcome of that would be, and I think particularly because it doesn't bear on our work. But if anyone else has anything they can share about that, happy to open the floor for someone else's understanding.
Well, I mean, it does in that, you have elementary schools that are totally virtual now, and kids are in. Anyway, I was just wondering if you knew anything about it.
Not more than that it is a piece of proposed legislation, and that the impacts that we would be particularly, there would be impacts on school agers if they were going back into the classroom, and childcare providers who were not doing remote learning anymore, but particularly thinking about if there is in person, that our pre-K classrooms in schools that were going back to in-person would be asked to return to in-person too. So that's the major impact on the division's scope of work.
Yeah, so our schools here, our elementary schools here in Union County are back full-time, or 4 days a week anyway, under A. And we're seeing a lot of elementary schools close for 2 weeks. Mm-hmm. And I think that may impact, because then you'll have school-age children that are out for 2 weeks, I don't know. it's just, and they're having to shut down the entire school if there's 1 or 2 cases because they can't contact trace. So there is definitely will be impact on us, on the providers anyway.
Thanks for raising that.
Any other questions? All right.
I'm sorry, Zach.
No, you're fine. Go ahead, Beth.
This is Beth Messersmith. I guess the one thing about the other schools reopening is that we are hearing from parents that it doesn't make sense to send a child back to early child care if they're having to be home with older children. So there may be increased demand for care. And I guess the other question I had was whether there was any additional update about the federal dollars and their uses and priorities that you could share at this point.
Yeah, so we received the notice of award Friday. And so the state of North Carolina will be receiving about $335 million to stabilize child care. So that is, we are really excited to begin planning to have that money out or begin to roll that money out. So stay tuned for more communication about that very soon. Very soon. Thanks, Beth.
Thanks, Ariel. I'm sorry,
Zach.
No, you're fine.
This is Ken. I just got a question. What do we think the plans are for that $335 million the state got?
Mm-hmm. So our hope is that we are able to do a similar kind of three-legged stool where we're supporting child care program business models, families, and our child care provider, teachers, and staff. The exact kind of split of that is something that we are going to be having conversations. So I guess I'll back up and say our hope is that we are able to provide some kind of like very rapid support for our child care programs. We know you haven't had checks since the end of December, so we are hoping to be able to do that while we have community conversations about how best to plan for those dollars. So that's our hope as of this moment. And as I said, we will be looking to have conversations with our community partners in the very near future. There's also some infrastructure stuff, so that would be part of what we'd also be looking for, just to make sure that we're all running smoothly. But that would be a very minor piece if we're able to do that.
Yeah, and one thing to keep in mind there too, Kimberly, is we did just get notification on Friday about 330 plus million. The first round, it was 118 million, but in the slides you just saw, we spent almost 300 million the first round. So really, it's easy to say 118 million. Wow, it sounds like we got twice as much, but from what we spent, I think it's pretty well in line with last time. So, so don't expect twice as much, I guess is what I'm saying.
Zach, thanks for raising that. And I will say the other thing is just we don't have, part of how we got up to that almost 300 million is by using some one-time funds that we had from another source, and we just don't have those kinds of reserves anymore. So what we get from the feds is kind of our only, we don't have other buckets to draw from at this point. So yeah, thank you for pointing that out, Zach. Absolutely.
It has rained and rainy day has been used.
That's right.
So
I think it's the right thing for us to do, but we're in a different kind of spot.
I don't think there's a provider that's not so grateful for what was done. So thank you.
We're grateful to you.
All right. One last thing I wanted to mention, and thank you for the report, Ariel and Christy, to your piece there. Thank you guys a lot. Rhonda and Christy and Ariel, myself met, as I had mentioned previously, that we were going to meet about workforce. And I think we had a fantastic conversation, just an initial, on the surface conversation about opportunities to funnel more applicants into our pipeline of childcare and just kind of talking outside the box a little bit. We got no definitive bullet points to bring to you or anything. We're going to reach out to other commission members and third parties to have a broader conversation, I think. But we had just a great conversation about, hey, there's an opportunity here right now there are people looking for work. There are childcare providers that need employees. There are obviously education requirements that we preface the entire meeting by saying that is not something we are looking to go backwards on as far as education requirements. But is there any type of flexibility or unconventional ideas to get people into this pipeline, get them educated, get them to where they need to be, and come out on the backside stronger as far as the workforce than we headed into this? Rhonda, I don't know if you've got more to add to that other than we've had great conversation, and I look forward to having it further down the road. But Rhonda, did you have anything else there you wanted to add?
No, Zach, you're right on target with that. So I look forward to continued conversations. I think that we are all on the same page and headed in the right direction, and we're going to do everything we can to seize this opportunity to strengthen our workforce in every way.
Thank you. Ariel or Christy, I don't know if you had anything to add there, but
just when we walk together, we come up with something better. So I'm excited to continue, excited to bring more voices into the conversation, and thank you for the chance to work alongside you to get this done.
Great.
Zach, the focus groups will be on workforce, and who knows, maybe something will bubble up from that.
Would love for something to bubble up. So yeah, that's a good point. Okay. All right. We're running about 15 minutes early, but I'm okay with that. It's better than the alternative. Has everyone just kind of been taking breaks as they need it, or should we take a 5-minute here and let everyone come back? All right,
5 minutes would be great.
I'm seeing some 5s held up. Let's go. It's 10:16 now. Let's go to 10:25. How about 9 minutes? 10:25. Let's report back. I think it looks like we're recording again. So, and Laura has just popped on the screen. So good to see you, Laura. You, as you know, are next on the agenda for our CCDF focus groups that are coming up. As was mentioned in the director's report, there's been an email sent out to providers. Hopefully they've all seen that and will have an opportunity to give some input. But Laura, I'll let you take it from here. So thank you.
Sure. Thank you, Zach. When we met in December, I gave you some information about the Child Care and Development Fund and the upcoming CCDF plan the division will be writing. I mentioned that we're planning to hold focus group meetings to gather input, and that these meetings will be held in February. These focus groups will be starting tomorrow, and they'll be held over the next 2 weeks. We are planning to have a couple more in March, and we'll talk about those in a few minutes. The commissioners who will be facilitators include Amelie Scholl, Melissa Brose, Dr. Sharon Foster, Brooke Child, Dr. Sharissa Blanchard, Beth Messersmith, Dr. Ioma Iruka Thompson, and Victor Coffenberry. So for those of you who are participating, they have reviewed this agenda. But I wondered if you all have any questions about the materials you reviewed before we get started tomorrow with our first focus group. Everyone feels good about it, ready to go.
I was going to say, this is Beth Messersmith. You all did a phenomenal job in preparing materials and doing the training. I just wanted to extend my appreciation. I feel much more comfortable now, and you all did a great job. Thank you for that.
Okay, great. And Alana Lambert helps me out with that too, so I'll let her share in that appreciation. Okay, so before I let you go, like as I mentioned, we're going to plan 2 additional meetings in March, which are going to duplicate the meetings that are held this week. The topics will be subsidized childcare and program quality and family engagement. We would like for commissioners to facilitate these 2 meetings as well if you're willing and available. If you're interested, either you can let me know now or you can email me after this meeting. We want to schedule dates as soon as we can so that we can give the public plenty of notice to be able to participate.
Hey, Laura, this is Amelie. Have you had RSVPs, or do you have any sense of participation or anything like that?
Well, I can tell you that there's communications have been spread widely across the state. We typically we've had between 30 to 80 participants. So it's hard to gauge how many it will be since it will be virtual. So between 30 and 80.
And we did not require pre-registration for this event, so we don't have an accurate head count. It'll just be the time of the event.
And I just want to verify, all us commissioners are invited to observe?
Absolutely, absolutely.
And can you send this around as a calendar invite with the link and everything?
Sure can, yeah.
I would appreciate that, thank you.
Mm-hmm. Yeah.
Laura, this is Rhonda. I'm happy to help if you still need someone. Just let me know.
Okay, for the March meeting, I would love that. Thank you.
That would be great. Thank you.
Okay. All right. Well,
I had one suggestion on the parent communications with the staff, but I'm doing the quality improvement and quality standards, so I don't want to go on anyone else's purview, but I could email you and use that as a suggestion, because we've used it at the Public Health Committee with, and it worked very well when we set up better care for pregnant mothers. They got weekly text on what the fetus was doing and what they could do to improve their health at that point of their pregnancy, and it was very, very well received, and maybe we could do something like that.
So, sure. Yes, feel free to email me.
Okay.
That would be great. Yeah. Well, thank you to those of you who are planning to help facilitate, and we look forward to working with you over the next couple of weeks. Thank you for your time today.
Thanks, Laura, and I think that's Beth. Thank you for saying too the preparation that was put into it, and hopefully we'll get its outcomes are what you're looking for. So hopefully all the work on the front end will provide us some good stuff to come in, and as Dr. Foster had mentioned, maybe some good stuff will come out of it that we can work with. So thanks, Laura, and everyone that's helped you with that. I did, as we segue kind of to the next topic, I did want to read Janie Truesdale, a commission member, has put in a note here to the commission, but Janie, I want to read this out loud. I want everyone to hear it. It says, on behalf of family child care providers, I want to extend words of gratitude for the PPE supplies delivered to our front doors. This act has helped tremendously. Prior to getting products delivered, many people shopped and found empty shelves. We are thankful. The monetary support lessened the worries of FCCH providers. Keeping children healthy and safe has and will continue to be a priority for us. The support provided has truly been appreciated. So, Janie, I think that's super kind of you to put out there, and thanks to the Division of Child Development and Early Education for helping a lot of people who couldn't find those supplies and don't have the resources to find those supplies to be able to get their hands on them at a time of need. So, very kind, Janie. Also, there was a question in the Q&A about whether any news on vaccines will be mandated. We're just going to leave that alone for a minute because I know we've got a big presentation on vaccines in about 11 o'clock today. So hopefully, and it may be before 11 o'clock today, but we've got a presentation on vaccines that we're all excited to hear about. So just stay tuned. That'll keep viewers watching, won't it? So, all right. Going to get an update now from, I'm at the 1050 spot on your agenda, rules updates. I think it's a pretty simple update, but Deidre, did you want to give us an update of where we are with all these rules listed here?
Yes, I just wanted to reiterate that the Rules Review Commission approved all, I believe it was about 35 rules. They became effective February the 1st, and I've updated the rule book, and I've also emailed you all the rule books. And the rule book will be going on the website pretty soon as well. So that's all I wanted to say.
And those are effective as of February 1st. So, and I know when we submitted them, there was a little talk about whether RRC would take it as is, as written and amended. And they did. Yeah. So that's all good news.
Yes, no problem.
Great. Thank you. And thanks to Amber and John for always helping us know what they may or may not like about what we do. So we try to do what we want to, and then they try to tell us that probably will be looked upon differently. So thank you, guys. All right. Well, we're getting through this pretty quickly. We're now to the vaccine presentation. Christy and Ariel, I know we're 25 minutes early there, but are you guys prepared to go ahead and do this?
I am prepared, Zach. Ariel and I can handle this, so you tell me when we can start and we'll get started.
That was a silly question. I know you're prepared, so no, we're ready and I think anxious to hear all this. So give us your knowledge on vaccines and where we're headed.
Okay. Well, good morning again, everyone. This is Christy, and before we jump right in on the vaccine presentation, I do want to take a moment because I heard Dr. Forrester's questions earlier about making sure that we keep childcare health and very safe and healthy. And so I did just want to mention, since we have a few minutes, a couple of the things that we are doing just to give you an update. We have, even though the childcare providers are not required to report to us when there are outbreaks or when they have teachers, staff, or children with COVID, many of them do. And as we began to go back in and do our annual compliance visits, our monitoring visits, we were recognizing that there were some childcare providers that needed technical assistance and help, and I mentioned this earlier, with some of the safety precautions and just some help in how to make all this happen. And so as we've begun to do our monitoring visits again, one of the things that we've been doing is we're working with our childcare providers, and if there were things that the childcare consultants saw, the biggest issues that they're seeing are people not wearing their masks as appropriately. Not that they're not wearing them all the time. They forget to put them on. The children can't really see or understand them. They may remove them, things like that. So when we're seeing these types of things, or if they're not doing proper screening before the children enter the facility, what we are now doing is we have partnered with our child care resource and referral agencies, our child care health consultants, and our local partnerships for children, our Smart Start agencies. And we are referring these programs for additional technical assistance. And we think this is really helping. We have only heard great things. Our child care health consultants have been phenomenal. Those are our nurses that are actually providing guidance to our child care facilities, answering questions. And many times it's just our child care providers not fully understanding how to implement some of the health and safety measures. So that is one thing, Dr. Foster, that I wanted to mention that we are doing. Good, I see that thumb. And I also wanted to mention another thing that we're doing with public health is that we were able to receive a small grant to do some sanitation and disinfection guidance and technical assistance. So we are in the process of getting ready to do a webinar for all of our child care facilities in February about how to do the difference between sanitation and disinfection, what they need to do, and even provide them some materials to make sure that they're doing that effectively. So those are two big things that we're doing to really reemphasize the health and safety in our child care facilities. And I would be remiss, and Tammy Barnes reminded me that we really needed to let you know the work that we are doing and the collaboration that we have with all of our partners. And then the final thing that I wanted to mention is, and Perry, this is for you. Perry Melton, one of our commission members, and others had brought up to us how important it was that the teachers be able to have their mouths showing so that they could help with language development and other types of things within our child care facilities. So we did a pilot project with child care providers back in the fall of these masks to see how they were, and we are working with a local North Carolina business, and we are finalizing the design. We were able to give feedback if the mask fogged up, if they were moist, those kinds of things. And it looks like that we will be providing all of our child care providers across the state with these masks that have the clear opening over the mouth so that it can enhance the development of the children. So that is another thing that we're doing. And Terry, thank you for your continued support and ideas and helping us to think through how that will happen. We hope to get those out within the next month. So just wanted to mention those things, Dr. Foster, in response to your question about how we're continually tracking what's going on and really trying to emphasize the health and safety in our child care facilities.
Christy, can I ask a question?
Sure.
This is Elizabeth Gilliland.
Yes.
I tried so hard to get my teachers to wear the masks with windows, and we still do have a mandate for certain times of the day to try to have some opportunity, and to get kids also to wear those, and we just could not make it work. Did you come up with a trick about because the whole condensation on the window problem was, we could not fix it?
Well, as we went through our pilot, there was some of that information that was shared that there was condensation on the windows, there was moisture in the cloth, and that's what we've been working with the designers to try to combat. There is an anti-fog solution that we'll be providing with the mask as we provide those, Elizabeth, and hopefully that will assist. But the unfortunate thing is I don't think we can get rid of all of it, but hopefully we'll continue to work on the design of the mask and see if we can't offset some of that.
Well, I'm excited that you're doing that because I could not get it to work. And you might also think about doing a sort of recommendation. If you haven't solved it completely, sort of recommendations about certain times of the day to wear it, and which you're probably already thinking about, but that's the only way we've sort of reconciled and resolved it a little bit at my school, and I'm really excited about your anti-fog solution.
So it's supposed to work. Yeah.
Okay, that's exciting. Wonderful. Thank you.
This is Emily. I will tell you, as a wearer of glasses and a mask wearer, I have learned, and my eye doctor did give me an anti-fog solution. You have to put it on like once every 24 to 48 hours, but it puts a film on the glasses that stops fogging. So it really does work as long as you reapply it. But it does work.
Well, that's good to hear. That's what they tell us. So we're hopeful that it will help with that condensation and make it a better product for our child care facilities to use. So be on the lookout. We'll give you more information about that as we roll those out across the state. All right.
Thank you.
Christy, I have one other suggestion.
Sure.
This really works. You should go on Shark Tank and get some help with marketing it, because every grandparent in the whole United States would love to have it. I walk in now, I've had one shot, and we'll get a second shot, but, you know, we're vulnerable groups, and when I walk in to see my 7-month-old grandson, he starts screaming because I look like, you know, Dracula with my mask on. And they're so attuned to your facial expressions at that day. You know, it's stranger danger, and they're going to scream. And I just feel awful. And you'd have a great market right there. You can make some
what
money.
a great idea. We could generate some income for to provide more support to our child care facilities.
Yep.
Thank you for that. All right, so I did want to mention those, but I now want to move into our vaccine presentation. I will say that Ariel and I are not medical providers, so Dr. Forster, please, if there are medical questions, we'll refer to you, but we have been trained about the vaccine and the rollout, and we want to provide that for you today. I'm going to do most of the leading of the presentation, and Ariel is going to be monitoring the chat and the Q&A. So if you have questions, I would just ask that you type those in, and we'll try to get to those at the end of the presentation. There is some important information that we do want to share about the vaccine and about where North Carolina is in the vaccine rollout, and hopefully hopefully answer many of the questions that you may have. So you may want to listen, and then as things go, if you don't think we answer your questions fully, please feel free to place those in the chat or the Q&A, and we will try to answer as many as we possibly can. So I'm not sure. Yes, go ahead.
We're trying to get that PowerPoint loaded. So
okay. All right. Well, I have a copy, so I can start.
Go ahead and get started, and I'll catch up with you.
Okay, sounds great. So like I said, what we are going to share is some important information about the science and the distribution of the COVID-19 vaccine. We also want to make sure that we do have time to answer questions. We'll have, hopefully we'll answer many of them, but if there are some remaining questions, we'll take those at the end. And we want to make sure that you have the best knowledge of where we are in this rollout of the COVID-19 vaccine. So just to sort of get us started, many of us on this presentation this morning, many of us on the call are still waiting for our spot to take our shot. And so what we need to do while we're waiting on that vaccine, I did hear as of Friday, we had vaccinated the first round of over 1 million people in North Carolina, and that's great. Oh, you just caught up quickly. I'm on the second slide, Ariel. While we are beginning to vaccinate, there we go, thank you so much, we need to remind everyone that we still have to protect each other from COVID-19, and that starts by us continuing to practice the 3 W's, to wear, wait, and wash. Getting the COVID-19 vaccine and following the 3 W's is everyone's best protection from getting and spreading this virus. We know that vaccinations are underway, and I'm excited because it does give us hope at the end of a really, really hard last year. At the beginning of this new 2021, it does give us hope. But this virus is continuing to spread. There are different variants of the virus, and it is contagious and in many cases deadly. So we need to persevere with following the 3 W's and making sure that we're taking the proper precautions as we continue to roll out the vaccine. We can move on to the next slide. So the good news is that you'll soon be able to take a safe vaccine to protect you from getting COVID-19. The vaccine is free to everyone, whether or not they have health insurance. The federal government is paying for the vaccine, so no one needs to be worried about having to pay for the vaccine. So what we'd like to do today is to let you know that, and I'm sure you've heard on the news and on other media outlets, that the vaccine supplies are currently limited, and you may have to wait for your spot to take your shot. But what we want to do today is to tell you what you need to know about how to get your shot, but also a little bit of the science behind the vaccine. We can move on. We know that in order to lead with equity, we must build trust. We know that systemic racism runs throughout our social, economic, and healthcare systems. And what this does is it causes unequal access to care, maltreatment, and neglect for many of our historically marginalized populations and communities. These long-standing and continuing racial and ethnic injustices, especially in our healthcare system, have contributed to the lack of trust in many of our vaccines. North Carolina is drawing upon experience and expertise from many of our leaders from our historically marginalized communities to develop and implement its vaccine plan. And we are continuing to communicate with many of our leaders from these communities to help us roll out this plan. So I want to start with just a few key points about the vaccine. First and foremost, and we'll go into more depth on each of these as we go forward, but just to let you know, the vaccines are tested, they're safe, and they're effective. The COVID-19 vaccine will help us, North Carolina, and each of us in our communities get back control of our lives and get back to being able to visit with people and going to places we love. What you need to understand is that scientists have had a head start with this vaccine, and there have been thousands of volunteers that have helped with the clinical trials. The vaccines are tested, they're safe, and they're 95% effective, the two that are out right now in the United States. You cannot get COVID-19 from the vaccine itself. And as I've already mentioned, we do have a limited supply of the vaccine at the current moment, and that we do anticipate there to be limited supplies in the next several months. So those who are most at risk have been prioritized to get their vaccine first. However, please know that you will have a spot to take your shot in the near future. So let's look at each of these points a little more closely. First, I mentioned that scientists had a head start, and they have built on decades of research and work to develop vaccines for similar viruses. So I know a lot of people have talked about how quickly these vaccines were developed and how they went through a rapid process for approval, but we had a head start. Our scientists had a head start. On this slide, you see one of our North Carolina natives, Dr. Corbett, who's from Hurdle Mills, North Carolina. She is one of the leading researchers with the vaccine, and she holds several of the patents for the vaccine. But these first two vaccines, both Pfizer and Moderna, use a method that researchers have been studying and working on for decades. So even though it seems like it's gone very fast, they have been studying viruses very similar, like SARS, that were very similar to the coronavirus, and they have been able, and they feel very good about where we have gone with the vaccines. And I will just mention that the vaccines are 95% effective, and that is much higher than many of the researchers had anticipated or expected, but it is proving to be the case. The vaccines are tested and safe and effective. All of the vaccines have been rigorously tested for safety and effectiveness, and they have been through all of the same clinical trial steps as other vaccines and drugs that the FDA approves. So they have not short-circuited any of the steps. They have gone through all of those steps. We know that there were more than 70,000 people in the original trials that volunteered for the two vaccines, the Pfizer and the Moderna. And the reason they used that many people is they wanted to make sure they were safe. And they are continuing trials and even engaging more volunteers as we move forward. To date, as I've already mentioned several times, the vaccines are 95% effective in preventing COVID-19, and this is higher and more effective than most scientists had hoped for. We also know that there are no serious safety concerns in clinical trials for either of these two approved vaccines. I'm sure you've heard of some rare occasions of a sore arm and things of that nature. So you could have temporary reactions to the vaccine, like a sore arm, a headache, or maybe just feeling a little tired and achy for a day or two. This is probably, or I think many of the physicians have said it's very similar to what you experience if you've ever had a shingles vaccine. These reactions are temporary, which means that they'll go away in a day or two, and they are not dangerous. And what we've also been told is that when you have some of these symptoms, like a sore arm or feeling a little tired, that these are actually good signs that the vaccine is working in your body the way it's supposed to be. Let's move on to the next slide. I mentioned that there have been numerous volunteers that have participated in the trials, and there has been an intentional effort to recruit volunteers from historically marginalized populations in both the Moderna and the Pfizer trials. When we say historically marginalized populations, what we're talking about are populations that have been the hardest hit by the COVID-19 virus, including African Americans and our Hispanic Latinx communities. What you see in this pie chart is on the left is the Pfizer trial volunteers that were sought and utilized, and on the right is the Moderna. And what you'll see is that the pie chart does show the racial and ethnic background of the people who volunteered. While there are many, many more that were white, you'll see that that Pfizer had at least approximately 26% of Hispanic and Latinx volunteers in their trials, while Moderna had 20, and the Black and African American population, there were about 10% in each. Even though these numbers are lower than their white counterpart volunteers, what we're seeing is that these historically marginalized populations are actually better represented in these vaccine trials than in most clinical trials. Participation in the trials has been higher than in most others, and there are still opportunities, as I mentioned earlier, where they are seeking out other volunteers as they continue to study the vaccine now and how it will impact our communities. So we're glad to hear, and we're glad that there is this intentional effort to recruit volunteers from our historically marginalized population. So let's talk a little bit about how these vaccines work. I mentioned earlier that you cannot get the COVID-19 virus from the vaccine. The way the vaccines work is it safely increases your body's natural ability to fight the virus before the virus attacks you. Vaccines, both the Moderna and the Pfizer vaccine, they imitate COVID without giving it to you. After you get the vaccine gives your body the instructions to make a protein that safely teaches your body to make an antibody to fight the real COVID-19 virus. Your body naturally then breaks down or destroys the protein from the vaccine, which you've probably heard as a spike protein, and then all it leaves you is the antibodies then to fight the actual virus. So with these antibodies, you can fight the real virus when it tries to attack you. I do want to mention, just to make sure everyone is aware, is that there is no tracker in the vaccine. And if you've had COVID-19, you still need to get the vaccine. Yes, you still need to have it, even if you've already contracted the virus and had it. The vaccine will work to protect you against a future infection. And you don't need a COVID-19 test before the vaccination. It is safe to get vaccinated with either the Pfizer or the Moderna vaccine if you have been infected in the past. 2 shots are necessary, and we have a plan in North Carolina to help everyone get both doses. So these first 2 vaccines, both Pfizer and Moderna, take 2 vaccines, 2 different shots, in order for you to be fully, for them to be fully effective and to fight off the virus at 95%. The Pfizer and the Moderna vaccines require 2 shots, and those 2 shots will help you to build up a strong immunity against the COVID-19 virus. The second shot will come 3 to 4 weeks after the first, and you need to make sure that you either, if you get the Pfizer vaccine first, you need the second dose needs to be the Pfizer vaccine, and similarly, if you have the Moderna vaccine, you also need the second dose of the Moderna. You don't need to mismatch. The Pfizer vaccine is actually scheduled 3 weeks apart, and the Moderna is 4 weeks. It's just the way the vaccines were made. And as I mentioned to you earlier, we in North Carolina have a way to make sure that everyone is getting the proper vaccine. We built a system. Our system is called the North Carolina COVID-19 Vaccine Management System. And when you go to get your vaccination, there will be some general information that will be put into the system. And one of the big pieces that is tracked is which vaccine you had. And so this will be there, so the next time that you go, all healthcare providers would have access to it, and they would be able to track to make sure that you're getting the second dose of the proper vaccine. But like I said, you do need to get both doses of the vaccine, 2 shots, in order to be fully protected. Millions of Americans have already received their first dose. As I mentioned last week, we heard that over 1 million folks in North Carolina had received their first vaccine. You may recognize these folks on the screen. Mr. Frank Jones of Wilson County is a community leader. And then, of course, many of us will recognize former Governor Jim Hunt at the bottom. These 2 individuals have already received their vaccines and are encouraging others to do the same. Can go on to the next slide. This picture is Representative Shelley Willingham. He received his first vaccine when his local county began vaccinating people 65 years and older. He is a current member of the North Carolina House, and he represents Edgecombe and Martin counties in the Northeast. And I just love his quote that's represented here on the slide, that he said, I want to be around my grandkids, and I like being out and about. And the sooner I get vaccinated and the sooner other people get vaccinated, then we can finally get ahead of this virus, and we'll be able to do more of those things that we all enjoy doing. Again, many of our community leaders are speaking out and helping us get the message out. One other thing that I do want to mention is that when you get your vaccine, that your privacy and personal information are protected at all times. There is nothing in the vaccine that can be tracked. The protein your body makes cannot be tracked, and it disappears after it finishes making you stronger and produces those antibodies. Personal information about the vaccination and health are protected at all times. They're protected under HIPAA just like other medical information. And one thing that I think people need to realize is that even when we report the vaccinations to the CDC, we are not sending personally identifiable information. Just so you know, you do not have to have an ID in order to get your vaccination. North Carolina does not require an identification card like a driver's license or any type of identification in order to be vaccinated. However, I do want to mention that dependent upon employers that you work for, some employers or healthcare providers could request an ID if there's limited doses, just to help with the prioritization and to make sure that they're doing what is, they're vaccinating the people that are supposed to be vaccinated at the current time. I mentioned to you earlier that we have this COVID-19 monitoring system. This is the system that enables the collection of immunization information for health and safety reasons only. And this information, as you see on the screen, requires a few things. It asks for your name, address, date of birth. It will ask about the location, or they'll put in the location of where the vaccine was given. And on that, they'll put things like expiration date of the vaccine, an identifier number, those types of things so they can track the type of vaccine that you were given. They'll also put in there information about how the vaccine was given. It was given in the muscle of the right upper arm. And they're also collecting information about race and ethnicity. And the reasons for that is to make sure that we're giving or having an equitable distribution of the vaccine across North Carolina. When this information is reported to the CDC to meet the federal requirements that have been established by the CDC and in accordance to the North Carolina state law, we will only be submitting the vaccine recipient's year of birth, not the date of birth, but the year of birth, and the first 3 digits of the vaccine recipient's zip code of residence. It says if the underlying population in that zip code includes more than 20,000 people, and the date of the submission is what will be submitted, and you see that there on your screen. So personally identifiable information is not going to be shared. Let's move on. So our goal is to vaccinate as many people as quickly and as fairly as possible, given the limited supply of the vaccine that North Carolina is receiving. Limited supply means that we had to prioritize those who are at higher risk of exposure to the virus and the sickness and maybe even death. And so that's why we have a rollout and a prioritization plan, because we don't have enough vaccine for everyone at the present time. We're continuing to get more and more, and we have seen that production increase since we've begun the vaccine distribution. Demand right now for vaccines vastly exceeds our supply, and in some cases, this limited supply is also going to create wait times. So we ask that you be patient. Our health departments and our hospitals are the ones that are providing the vaccine at the present time. And as you can well imagine, they have just been overwhelmed. And so we ask that when your priority group is up for the vaccine, that you have patience, because it is going to take us all working together to get this vaccine distributed as quickly and as fairly as possible across the state. Moving on, vaccines will be available to all, and as I've mentioned, they're free for all. Supplies are limited at first, and we hope that will get better as we move on. The Pfizer and the Moderna vaccines have been authorized to be and sent to all of the states in the United States, but there will still be some time before they're widely available to everyone. So, as we've already mentioned in this presentation, health experts recommend that the best way to fight COVID is to start first with vaccines aimed at helping to slow the spread and to save lives. And while you're waiting, that you continue to follow the 3 W's. The vaccines are free to everyone, whether or not you have health insurance. And rest assured that more people are going to be reached as we see the vaccine supply increase as we move further into 2021. But everyone is going to have a spot to take their shot. This next slide basically shows how North Carolina has chosen to prioritize the COVID-19 vaccinations. And please note that we did follow CDC guidelines, as well as, and I'll show you in just a few minutes, some of the organizations that we have been working with and many of the folks that we have contacted to make sure that we are doing what we think is best for North Carolina. There's been over 60 folks that have been on the task force that's helped us to determine how we were going to roll out the vaccine in North Carolina. So they will be available to everyone at some point, but currently, as I've already mentioned many times, the supplies are limited and will continue to be limited over the next several months. Therefore, we started with the purple. You'll see group 1 at the top. This is an active group. In mid-December, we began vaccinating our healthcare workers who were actually working in units that were fighting the COVID-19 virus, like those caring for patients, those that were cleaning the rooms where they were serving patients with COVID-19, and our long-term care staff and residents. That's all of group 1. North Carolina has now moved to group 2, and in group 2, we started by giving priority to those who were 65 and older. So if you look at these, our next step is group 3, which is our frontline essential workers. This will include people like firefighters, grocery store workers, and one I'm most excited about, our teachers and our child care providers. So we are very excited. There's a full list on the CDC website and on our DHHS website if you want to know who other essential workers are. But we are in the process of, Ariel and I have met multiple times. We're working with the department to have a more precise rollout for our child care providers in the upcoming weeks. And that's going to happen sooner or later, and you'll be hearing much more information on this. We plan to do, starting this week, we're going to be getting information out, and we'll be doing this presentation for our child care providers. And very soon after that, we'll be distributing and communicating about the rollout plan. You can see that if you get down to group 5, all of us will be vaccinated at some point. There is much more detail if you go to the DHH website and look under your spot, yourshot.nc.gov, and you can find out which phase you or your family members are in, and I'll show you some of the pages in just a few minutes, and it will tell you when you will be eligible. Think about this vaccine rollout with these different groups as sort of like if you've ever flown and you are boarding, basically group 1 goes, but then if you're in group 1 and you didn't get it at the very beginning, when group 2 or group 3 is loading, you can still go and get your vaccine. So it's going to work very similar to that process. Let's move on. COVID-19 vaccinations is, as I've said, our goal is to vaccinate as many people as quickly as possible, given the limited supplies. And as we move through the vaccination groups, we are aligning our federal priorities while empowering our local health departments, our hospitals, and other vaccine providers with flexibility to move on to the next priority groups as they complete groups in their communities. So we know that people are very curious. Probably many of you are sitting there asking what's happening and when am I going to get my vaccine. The people who are getting COVID-19 vaccines right now are healthcare workers like our doctors and our nurses and those that are caring for them. and those who are cleaning up in those areas, our long-term care staff and residents, people living and working in places like skilled nursing facilities or group homes. Our healthcare workers are being vaccinated in hospitals and through our local health departments as they receive shipments of the vaccine. And we'll talk a little bit more on the next slide about the vaccines, but the federal government manages the vaccination for most long-term care facilities. Most will be vaccinated at their facilities under the Pharmacy Partnership for Long-Term Care program. So what is happening across the nation is that the vaccine producers are actually partnering with some of our local pharmacies like CVS and Walgreens, and they're actually going into those long-term facilities to give those vaccines. Let's move on to the next slide. North Carolina, as I mentioned, receives shipments of COVID-19 vaccine each week. The federal government decides how much of the vaccine each state gets based on the state's population. And then the Department of Health and Human Services determines which vaccine providers, like hospitals or health departments or clinics, will receive the vaccine doses based on their ability to reach those marginalized populations and their prioritized populations, such as healthcare workers or long-term care health workers, or those folks in North Carolina who are 65 or older. Then the manufacturer, whether it be Pfizer or Moderna, they actually ship the vaccines and the vaccination supply kits to those local vaccine providers. So they are shipping them directly to the hospitals or the health departments. And then North Carolina works closely with the providers to make sure that they're safely stored and handled, especially those that are needing to be stored in ultra-cold settings. And as I've already mentioned, many of the vaccines right now are available in hospitals and at health departments and at the long-term care facilities when they go out and provide those vaccines. But they're really not available yet in many of our clinics and pharmacies. We do hope that that will change in the next few weeks, where some other folks will be able to participate, other healthcare providers, in actually giving the vaccine. So moving on, you may be wondering, how will you know when it's your turn to get your shot? If you're a healthcare worker, you should already be on the list or be a priority, and you should talk to your employer about getting vaccinated. If you're a long-term long-term care staff member, or if you have a resident or know a resident, then they should talk to the facility about how they're going about the vaccination within their facilities. If you are 65 or older, there are certain approved vaccine providers, health departments and hospitals, and then there's some clinics that I'm sure you've heard of that are being held across the state. You can schedule an appointment or go first come, first served to many of those clinics and get your vaccine. But do remember that we are prioritizing 65 and older right now. I would say if you have questions, you can contact your local health department or hospital, but please, as I've already said, they're being overwhelmed with questions. You're going to have to exert a little patience and wait. But according to the availability and how far they've gotten with vaccinating these priority groups that I've already mentioned, then they will begin to vaccinate other groups as it becomes available. The best place to find any information is right here on the screen at the very bottom, yourshot.nc.gov. Please go there. There's also a 1-800 or 1-888 number that is a COVID-19 Vaccine Help Center that can also help you if you have questions. But many primary many primary health providers, like your local doctor, please understand they probably do not have the vaccines yet. So those who do not have an employer or residence in a facility, a long-term facility, then you should contact your local health department. or call the 1-800 line, or go and use the resources that are available on Your Spot, Your Shot to determine when and where you can get your vaccine. Keep on going. Our hope, a goal is to keep everyone informed so that you have a spot to take your shot. We're working very hard to keep North Carolinians informed. We can provide, there are many of us who are trained to provide this presentation. So if you have groups of folks that would be helpful for us to reach out to, if you'll let Ariel or I know, we can try to work with our list of trained trainers who can go out and provide the most up-to-date information. This actual presentation is available on the website, Your Spot, Your Shot. And so please go out there. It is updated a lot. It's updated at least multiple times a week. And so we're not sending this out to folks really, because we want you to go to the website to see the most updated information, because it does change. But we're asking that if you're members of community organizations, and many of you are community leaders, you help us in making sure that we get this information out so that more North Carolinians can understand what's going on. Our goal is to provide all North Carolinians with a spot for honest information and updates on when they can get their shot. North Carolina is working to build better ways for more people to find out the information. The best thing you can tell people is to use yourspotyourshot.nc.gov. It is the most reliable and most up-to-date information. You can share with them the 1-888 number. And then there's also on the Your Spot, Your Shot website, you can find your group. And that will help you to know when it's your turn, and then you can find a spot of where they're actually vaccinating people. I've gone in and put it in, and they told me I have to wait. I'm not old enough yet, and I'm not one of the priority groups, but it will tell you if it is your time. The next slide shows some online resources. Find My Group, Find My Spot. These are just screenshots of what they look like. So your spot, where do you go, and is my vaccine group up to the priority list right now? You can find that on that website, Your Spot, Your Shot. Here are, I mentioned these earlier, leading medical and professional organizations who are really encouraging Americans and North Carolinians to get vaccinated. You see and probably recognize many of those organizations. We really are encouraging as many Americans as possible to get vaccinated when it is their turn. On the next slide is online resources. There's a one-page flyer that's available at yourspotyourshot.nc.gov that really talks about the vaccines and how they're going to be distributed in North Carolina. There's a wonderful frequently asked questions document. It's updated on a weekly basis for every question that we get. I know I had one that I did a presentation on a couple of weeks ago, and it's now been added. And then there's also the deck that I'm using, that I'm sharing with you today, that I mentioned is out there. There's an infographic about the prioritization that we went through. And there's also some PSA videos from some folks you might recognize, like Secretary Cohen and many other community leaders across North Carolina. So we want you to emphasize to use the vaccine website, yourspotyourshot.nc.gov. It is where you can find the most updated information about the vaccine. And while you're waiting for your turn, please, please, please continue to practice the 3 W's. It is everyone's best protection from getting and spreading COVID-19. And it is what we need to continue to do as we are trying to get back in control, getting back to our family and friends, and getting kids back to school. It's going to take some time, but the COVID-19 vaccine and the 3 W's will help us get there much quicker and much safer. So last slide, we're asking for your help to share information with those in your community. Again, sharing with them the website, yourspotyourshot.nc.gov. Direct them there on their help direct people to their spot for reliable information. That is the spot. Show people that you trust the safety and effectiveness of the vaccine. Share your positive experience if you have had yours. And then use and share the COVID-19 vaccine communication materials that we have gone through today and that are available on the website so that you can share the most accurate and up-to-date information. And you find them all on yourspotyourshot.nc.gov. So I am finished. I just gave you a whole bunch of information. I hope some of it was helpful. And I'm going to turn it over to Ariel to see if she has questions that the group may have provided during the presentation.
You guys were pretty easy on us, y'all. There was one question about will vaccines be mandated, and the answer is that North Carolina, the state of North Carolina, is not planning on requiring people to be vaccinated against COVID-19, but it is possible that your employer or your school will require the vaccine for employment or student status. So that's kind of a yes, but answer. My recommendation would be to check with your HR department or whoever answers HR questions in your organization if that's a question for you. And then Beth just recognized that North Carolina is prioritizing child care workers, that some other states are not doing that. And we felt like it was really important since child care has been on the front lines for this whole entire year. So I just don't see I don't see anything else to do but to prioritize our industry for vaccination. So are there other questions that came up for people as they listened to the presentation? Concerns, things that you've heard, myths we need to bust?
This is Amelie. I just wanted to make a comment. The while you wait, just about everybody has a smartphone and a smartwatch. There are apps that will remind you, like when you get home, to wash your hands. And we've instituted it here, and it's helpful. And I don't think many people, or maybe some people don't know about it, but any daily reminder that you can get to do those things are important. Great tip. Thank you.
This is Rhonda Christie. Real quick, I just wanted to say thank you for this presentation. One of our directors was texting me and she was like, "What a great presentation." And it just shows just how much our division supports our workforce, and you and Ariel have represented that, and the other representatives on this call as well. And I'm just so grateful, and I look forward to using this tool to provide for our staff to be able to see this. So this is wonderful. If I didn't have some antibodies, unfortunately right now, I'll go ahead and get ready to sign up for it. So this is just what we need. And I also just want to make one quick mention. Thank you for working so diligently. I don't know who the team was who trained you ladies or who put this together, but I am just continuously pleased with you ladies and our state representatives for making a point to address the need with a historically marginalized population. And I know that's because you're doing the real work, and I know how important getting that information out and teaching them and making everyone aware of what that looks like in this pandemic. So thank you. Thank you, thank you, thank you. I have extreme gratitude, and I'm sure I speak for most providers in North Carolina. Thank you again.
Thank you, Rhonda.
Dr. Forster, I was going to ask you, Dr. Forster, if there was anything that you wanted to add, because I'm sure I messed up on some of that medical stuff, but I've tried to do my due diligence and learn as much as possible. Dr. Forster, I can't hear you. Can you?
I've been listening to these type of talks at all the medical continuing medical education that I've been going to since last March, and it's been 35 hours that I've spent on it. So you did a great job. I just want to caution everybody, because I'm old, I've had the first vaccine and we'll be getting the second one on Friday. And I think we're very close to being able to go to the local pharmacies, because I've signed up to be a volunteer vaccinator and at the Falls River Pharmacy in Raleigh 2 afternoons a week for 4 hours each time. And I've, in the last 3 days, have had to turn in my license number, everything. They're really ready to go right at the start line from the minute that they get the vaccine. So that's the good news. And once we get the vaccines in place, I think it's going to start going much quicker. The other thing is, as of last week, they had cases in the United States Congress of positive COVID tests in asymptomatic people who had received the vaccine back in December, and they'd already received 2 doses and it had been more than a month. They were asymptomatic, but we don't know if they're spreaders. So even after you have the vaccine, it's important to stay masked and keep your distance so we don't spread it to other people. There's still a lot of information out there that needs to be gathered on those people that are asymptomatic and have had the vaccine, whether they can pass it on to other people. But until we're sure, we still have to mask. And it may be that we have to achieve herd immunity, which requires close to 80% of us getting the vaccine before we'll be able to unmask. So everybody go for it and get your vaccination so we can achieve herd immunity and get back to normal.
Thank you so much. All right, hearing no other questions. Ariel, is there anything you would add?
The only other thing I would add is that that it's really important to us at the division and at the department that this presentation is shared widely. So we are working on a plan to get this presentation out to the childcare community more broadly. And Christy and I are available to be a liaison to you should you need any help scheduling a presentation out with a civics group or something like that, or if you have any questions about any of the vaccination rollout. We are ambassadors to the department and the state for this. Our recommendation is that you send the email to both of us so that the likelihood that it does not fall in the email chain is less if both of us are on the email. So don't hesitate to reach out. This is really, really important. We really want folks to feel confident in their vaccination choices and ability to get it safely. So please call on us for that.
All right, Zach, I'll turn it back over to you. Thank you, guys.
Thank you. You were supposed to talk for 30 more minutes, even though I started you 30 minutes early. So actually, it sounds like you did your part. I didn't do mine, but thank you guys for that. That's very informative. I think, a lot of people, I think we've all been at some point, whether just initially or even still, I don't want to say reluctant, but just kind of a little apprehension towards what exactly is this vaccine. So I think the more information and science that we can put out there, the better. I will tell you just from personal experience in my child care centers, we've got a few counties that have started asking for names of people, employees that want to be vaccinated. And what I've seen with multiple centers is that it seems to be a contagious decision, where some staffs, I'll have 75, 80% of the staff wants to be vaccinated. In another facility, I'll have 10 to 15% of the staff that wants to be vaccinated. So it seems, I don't really see the 50-50. I see more of everyone's on board or no one's on board. So I think the more of this information we can get out to providers, I think the better informed they'll be with their decision and hopefully take the right steps towards getting vaccinated. So I don't know how that looks across the state. Just know what it looks like in my particular centers. So being influenced a lot by others, positively or negatively. So Yeah, thank you guys so much, as Rhonda just said in the chat. Okay, moving on to the next on our agenda, if you look, is the public hearing and public comment. I promise, guys, we tried to move this up and consolidate it so we didn't end here like we have in the past with kind of this cumbersome time of nothing. So what I'd like to do is move the rules discussion, which is listed at 12:30. If we could go ahead and put that out now, start this conversation. Shouldn't be a long conversation. I think it's more about a direction that we care to go. Hopefully that'll take us up to our public hearing. And Amelie, we may be able to have some time there, depending upon, I haven't seen the list yet of how many people would like to speak, but we may have some time there if you'd like to go over that fiscal note just as well. So if no one has objections, I want to go ahead and talk about this rulemaking discussion. And what that discussion is basically is that we need to decide if we want to move forward with the temporary COVID rules. You guys remember we made, I think it was 4 rules back in, well, I guess they were emergency rules, and then they became temporary rules. And so here we are. We've got 270 days to do that, or they expire. That date would be August the 13th. That they would expire. I don't think we believe that COVID is going to expire by August the 13th. Wouldn't that be a fantastic wish? But nonetheless, we've got to decide what direction we want to go with these, so that we can vote and publish and you know, all the steps, the hearings, and everything that has to go into place to make these permanent rules. We've had some conversation about it on our planning call. There's, you know, do you make them vague and broad rules so in any emergency situation in the future that these rules come into play? Personally, I didn't love that idea, nor did many other people. These rules I think we made are COVID specific rules. And I'd really like to applaud this commission by saying it seems now with our new platforms of virtual platform that when, I guess, natural disasters or pandemics or whatever it is comes up, we seem to be able to jump on here and make rules specific towards that instance. And I like that feeling, that we can do that moving forward. But we need to talk about these specific rules as far as, do we make them permanent and put an expiration date on them, so that for the next, and I'm just throwing out numbers here, 2 years these rules are in place and then they just automatically expire. I really like that idea, as opposed to trying to take care of every pandemic in one swoop. Do we let them expire on the 13th and then we go back to the drawing board and do it all again? I'd like to hear your feedback, and I'll say the division is also working on some language there, and this meeting was last week. Haven't had time to bring anything forward, so don't feel like I've got an answer here for you. But we are looking at some verbiage to bring that would, I think the idea was to go ahead and let's make them permanent, and then let's get some verbiage in there that is consistent with what we've said on the previous 4 rules that have been our emergency and temporary rules, and allow them then to expire at some set time. I don't know, Deidre, it might be easier before I just open the forum here and let everyone speak. If you want to kind of walk us through that rulemaking process, we all know it, but somehow we forget it until you tell us again. So if you would do that, I would greatly appreciate it.
Emergency rules, and then the temporary rules are adopted emergency rules. So your temporary rules will remain in effect for 270 days from the date that it's published in the register. So that 270th day, as Zach said, would be August the 13th. So in order to keep these rules alive, so to speak, your commission would need to adopt them before August the 13th and submit to the Rules Review Commission. They don't have to be approved by Rules Review before they have to submit to them. So what we need today is to set up some additional meetings so that we can meet that deadline. And I've come up with a couple of dates that you could, a couple of dates that you possibly could choose to meet this deadline. If you wanted to stay on track with your current next meeting, with that, it means you would have to have a meeting, a public hearing in between June 16th and August the 8th.
And Deidre, you broke up a little bit there on my end. You're saying that's to keep the May 3rd meeting? Deidre, if you're speaking, I can't hear you.
Zach, I can't either, so it must be.
Okay. Well, can you try again, Deidre, please? I'm sorry.
It appears Deidre has lost possible connection. Maybe she's trying to reconnect.
Okay. What Deidre was saying was basically that we would need to schedule additional meetings in order to meet the August 13th deadline. And the last date to meet this deadline would be for the commission to vote to publish the rules and fiscal note during their May 3rd. So it looks like we could keep that May 3rd meeting. Then the public hearing will be held between the 16th and August 2nd. So the commission would need to meet and adopt the rules and a fiscal note before August 13th. This date would allow for enough time for the fiscal note to be approved. And that's what Deidre was explaining better than I can just sit here and read it to you. But it sounds like the May 3rd meeting can stay, and then we can take care of everything from there. Amber, I didn't know if you had any comments towards language. I'm sorry. Deidre, are you back?
I'm back. My internet is going in and out. It's spotty today.
You're okay right now. So talk
okay. So what I was saying, if you want to stay with the May 3rd meeting and go ahead and have your public hearing between June 16th and June 8th, you could do that. And then you would come back and adopt the rules before the 13th. So you would need to set a date for a public hearing, and then you would have to need to set a date after the comment period and before August the 13th. The comment period would end August the 8th for that. So that's one option. That's your absolute last date to have those rules filed by August 13th. If you wanted to shoot for something earlier, and I think this will give the fiscal note enough time to get through OSBM and the department, you could have a meeting in April, before April the 12th. Your public hearing would be May 18th through July 2nd. And then you would come back and adopt them before August the 13th. And we will still meet that deadline. The other date is April the 26th. You would have your commission meeting before then. Your public hearing would be June 1st through, the comment period, let me say that. You can have your public hearing between June 1st and July 16th, with the comment period ending on July 16th, and then you would still meet the deadline.
Okay.
So,
thank you, Deidre. Go ahead if you had something else. I'm sorry.
No, I was just going to say, I think the April 26th and the May the April meeting, the April 26th, and the May 3rd meeting, I think would be best in order to make sure the fiscal note and the rules are through OSBM, because I don't know what kind of fiscal impact this may have.
And that shouldn't be a very long meeting on April the 26th.
No, it
right?
shouldn't be. I wouldn't think.
And I say that just so if you guys are trying to figure out if that's possible or not, it shouldn't be a real long meeting. So, Amber, I'm sorry, I kind of half called on you, and then did you have anything to add there?
No, you're fine. So, like Zach said, we sort of talked about you've got these temporary rules, and you certainly have the option to move forward with the exact language that it is. What it is specifically where we're looking at is the scope. It is specifically tied to the state of emergency for COVID-19. So while the state of emergency related to COVID-19 is in place, these rules are effective. And sort of going back, our concern is that state of emergency is not going to be done by the August 23rd date. And unfortunately, that means that you have to do the work, start the work now in order to prevent these from lapsing in the meantime. It is, certainly our hope is that we're out of the state of emergency and life resumes and kids are going back to school and all those sorts of things, but we want to be prepared in case that doesn't happen, so we're not scrambling, that we've done all this work and Deidre's got all these dates in everybody's calendars and we don't have to come back at the end and, panic mode. The other option that we sort of discussed and my position as representing the division is that I agree with Zach. I think it is the way that the rules are written and what we've addressed is very specific to this pandemic. I do think it's possible, and actually, Dr. Foster, I was going to ask you if you had any thoughts on this, that we have the possibility of expanding the scope, because for all I know, and this is what happens in my head, for all I know, COVID-19 ends, we come out of that state of emergency, but then we have a variant or something very closely related that gets called COVID-21 or COVID-22 next year, whatever it is. So if it's that closely tied to COVID-19, so we could create language that essentially says for COVID-19 state of emergency or anything related or arising out of COVID-19 that results in essentially school-age children not being able to attend public school, that they could also apply. So I'm not saying you have to it only has to be for COVID-19, like something related, we could create language around that. I think you're going to get into dangerous water if we're drafting language that talks about sort of any state of emergency, which we had sort of discussed that. Again, I don't think we're talking about, bad weather situations. I don't think we're talking about temporary states of emergency. These really were put into place for this long-term public health crisis, kids not being in school situation. So I would, my recommendation to the division is that we would not recommend, expanding it much past that. But that's just sort of my thoughts on that. And the language that I was looking at amending, if anything, is the scope, which is your 3101. So far, the rest of the language seems to have been working out okay, but I certainly want to hear from people, or from the commissioners, if they think that there's other things that need to be tweaked.
I have a comment. Can you hear me?
We can. Go ahead, Dr. Foster. Thank you. And thanks, Amber.
The rollout for children to be vaccinated for 12 to 16 probably won't be till July or August. And then for the little ones, it's probably going to be another 6 months because they have to do the studies on the various age groups to make sure of the safety features for each of the younger age groups. So I think we need to extend this at least for a year because a lot of parents aren't going to be wanting to send their children back to school until their children are vaccinated. So I'm right there with Zach. If we could expand the language a little bit to COVID-like issues, but I think the companies manufacturing the vaccine are going to be right there as the variants develop, bringing in. It's going to be like the flu shot. They're going to be tweaking it every year, and we're going to be ending up getting COVID shots probably every year or two with the tweaking going on. So I think that we're going to be covered pretty well, but we just got to get everybody through the first term and get the kids' studies done so we can get them vaccinated. But another year is it's mandatory at this point.
Thank you, Dr. Foster. Yeah. Sounds like we need to make a permanent rule that expires.
Yeah.
Talk about oxymorons, but sure. So anyone else got some thoughts or questions or ideas on the commission? I'd love to hear them.
Zach, may I? I know I'm not on the commission, but I wanted to share something.
Absolutely, John. As far as I'm concerned, you are on the commission.
No. I'm on my side of the street.
But yes.
I want to repeat what I had said during the planning meeting when you and Rhonda and some of the division staff and Amber were present, which is I represent an occupational licensing board that had temporary rules passed last year to allow its licensees to take all of their continuing education online. We had an in-person requirement for half of them because of the value of in-person continuing education for that board. They interpret for the deaf and hard of hearing, and that interpersonal communication and work is very important. So we did a temporary rule. Everything was fine with the Rules Review Commission. We wanted to do it again for a year, so we thought, well, let's do another temporary rule for a year, but we were told flatly no. COVID-19 is no longer unforeseeable. I spent a little bit of time with their counsel arguing how many components of COVID-19 are unforeseeable, including none of us expected, I don't think, to be this long working remotely and things like that. I remember leaving my office in March of last year thinking, gosh, I might be out until June, and I'm still working from home here in February. So then I quickly just decided, no, don't fight with them on that. Just do a permanent rule. That's what they suggested. We explored some parameters about whether to have it during states of emergency or things like that. But what they decided to do, and certainly you all are free to do what you want within whatever the RRC will allow you, but what they did was they allowed the licensees to take all of their continuing education credits online for the next 3 years, and we specifically mentioned the years. And then that's in a permanent rule, so it will be the board can either erase it after that time, or the next periodic rules review, which will be coming up about 2026, it'll just fall off. We'll check it as no longer applicable or whatever the box is. I forget the exact term, but it's basically inapplicable, and then it'll just die on its own. It'll be no longer effective for those last year or two, and then just die on the vine. But there are many different options. I'm not trying to steer the commissioners in any particular way, but you do have some options in whatever you choose. Thank you.
Thank you, John. And yeah, that conversation is what kind of led our thoughts in this direction. That was very helpful, John. So thank you for bringing those other experiences to this commission. Anyone else have questions or thoughts or just a thumbs up, you like this idea, and let's plan meetings, or help me, guys?
Let's plan meetings.
Okay. Sounds good. So following Deidre's suggestions there, which are much more vetted than me just guessing at it, let's we'd say April 26th, Deidre, we could meet on that date, and then obviously we'll be meeting the following Monday, but we could meet on the 26th and keep this thing moving at a progression rate that'll get us to where we need to be by August the 13th.
Yeah, we meet on the 26th or before the 12th.
The week before the 12th is the Easter week.
I was going to say that runs into spring break.
Yeah, it does. I agree.
I'm good for the 26th.
What
I don't know what it looks like for everyone else.
What we will be doing, what you all would be doing on the 26th is voting to publish the rules and the fiscal note at that time.
Deidre, I'm gonna ask a question that I'm probably thought I'd never ask this, but when exactly is our next rules review? I know it's a 10-year process, but I felt like we did it for 10 years. So
I think we went through it. I think we went through it in 2017.
Actually, I think I joined in 2016, and we were in it then.
Yeah, I'm talking about.
I'm not sure it wasn't 15-ish when we were doing it.
Yeah.
So
I think we did
that to kind of to John's point. Do we need to? And we can talk about this on the 26th. Don't get me wrong. I just didn't know if it was, hey, let's just put it in there and then we can just zap it out at that point, or if we need to put a date on it. But we can talk about it later. And I'm sorry for getting ahead. So
that's okay. I think we did this in 2017.
Okay. 26th, okay with everyone?
Good with me.
9 a.m. That seems to work.
Okay, so then you would need to set a public hearing date, and that has to be between June 1st and July 15th.
Okay. June 1st.
How long would it be on the 26th?
I mean, Deidre, you help me here, but I don't anticipate more than an hour at all.
It shouldn't be long, as there's not, what you all are sort of proposing to do today, I wouldn't think it would be longer than an hour, hour and a half.
Okay. Then I'm good.
Zach, this is Melissa. I may not be available on the 26th, but I will do my best. That's our board for our foundation is here that day.
Okay. And Melissa, I'm just going to say the way this timeline kind of plays out.
I'm fine with it. I will do my best to try to participate.
Well,
if I can get away from everything. So
sure. No, I appreciate it. And I appreciate you letting us know. And I think you kind of hear what our plan will be on the 26th, unless, if Mitchell decides he wants a much longer meeting and wants to give opposition, then
I'm zoomed out for the day.
So, that's, I think you probably understand what's going to happen there, Melissa. So,
yes, I'm totally good with it. I just wanted to let you know.
No, I appreciate it. Thank you. Okay. So now we need to jump to a June 1st through July 15th.
July 16th. You can have your public hearing.
Okay. And this is going to be a public hearing, which we're familiar with. I'm okay with those going ahead and being at 9 a.m. just as well. Is there any, I know we always try to plan it around lunchtime, Deidre, but for a special meeting like this, do you see any issue with the 9 a.m.?
No, that's fine.
Okay. Does someone want to throw a date out?
I'll just point out that the week of June 1st is Memorial Day, is that Monday. Heads up for everybody.
The 31st is, right?
Yes, sir.
June 14th, Flag Day?
That looks good. And that'll give us plenty of time, Deidre?
June 14th? Yes.
Ma'am. Okay. I know we're getting into summertime there, and that's always difficulty. So if you can't make it, we understand. But if we can do the 14th at 9 a.m. of June, that would be fantastic.
And then you would need to schedule a meeting to adopt the rules before August the 13th.
That as well would be a quick meeting, I would think, right, Deidre?
Yes.
But that meeting has to be after July the 16th?
Right. That's correct.
You're supposed to consider public comment. You don't have to act on or agree with public comment, but do allow enough time for that, the adoption meeting.
Yeah, the public comment ends July 16th.
I understand. No, I understand that's, but when the commission goes to vote on the rules
right.
we adopted, they need to have looked at
Time to
and considered
discuss.
public comment. Yeah, so build that
Yeah.
in. But it may not take long, shouldn't take long, but just, it may not be a 5-minute meeting or anything like that.
Sure.
How's August 2nd look for folks? Does that give us enough time?
It works for me.
It's good for me.
Can we do a different Monday? Is the 9th too close?
Is the 9th too close? Does it matter how close that?
It works. No, it works for me. As long as I can file it by August the 13th, I'm good.
Oh, I just saw Susan can't do the 9th.
Susan can't do the 9th. I see that.
Could we do something other than? Can we do like the 3rd or something? Just the Monday. That day is already booked for me.
Sure.
Tuesday works for me.
Yeah, they don't have to be on Mondays. I just seems that's just where I was looking on my calendar. I'm fine with the 3rd. Any opposition to the 3rd of August?
Works for me.
I just need to be done by 11. This is Beth.
Okay. Let's do 9 a.m. on the 3rd.
And what's our goal again for that meeting, Zach?
That's just a vote to publish, right?
No, this is the vote to adopt the rules in the fiscal note.
Wrong word. Adopt. I knew what we were trying to accomplish. I didn't forget which one it was.
Okay, got it.
Yep.
Okay, so if I'm not mistaken, the April 26th meeting is only to vote to publish the rules and the fiscal note. And then we're going to have the public hearing on June the 14th. And then you come back August the 3rd to adopt the rules. Is that correct? And all meetings begin at 9 o'clock.
Yes, ma'am.
Okay. And then we're going to come back on May 3rd for your scheduled meeting that you already
That's
have.
correct.
Okay.
Great. Okay. Well, good. That'll hopefully help get these rules permanent so we don't have to continue touching them, but also with the understanding that these rules are specific environment and would love to get out of that environment so that we can get out of these rules. So thank you guys for coming together and doing that. I'm going to switch gears here, and if there's still conversation around that, we may have time here for it, so don't feel like I'm cutting you off. I apologize, but let's go ahead and switch gears now. It is 12 o'clock, which is the time that we were supposed to open the public hearing and public comment. I've got basically this public hearing is being held on the proposed rule amendments to 2828 and 3013 and its fiscal note. The agency has proposed edits to rules 2828 to provide clarification for the self-study, self-assessment requirement beginning at the 2-point level in program standards. The self-study, self-assessment must be completed for any family child care home provider who is applying for 2 or more points in the program standards. The agency also proposes amendments to Rules 3013 to increase the education and training requirements for NC pre-K teachers and assistants. The comment period is January the 15th through March the 16th, 2021. Written comments to this may be emailed to Deidre, or they may be mailed to DCDEE. I think both of those addresses are on the division's website, but it's Deidre.Alston, DEDRA.ALSTON @DHHS.NC.gov, or the division's website. I'm sure it has a mailing address if you'd like to do that. Also, if oral comments are given about the rules for the public hearing, please ask the public to identify the rule that they are commenting on. So I recognize we've kind of got general comments and public hearing all together here. Typically, we would have these as separate 30-minute time periods. We're going to see how many people we have, but we do need to make sure that we give 30 minutes to each as it was published. So hopefully those time periods can coincide, but if not, no worries. We will deal with them appropriately. So do we have a list of names, Deidre, or whomever's taken that list? Rachel, I'm not sure.
I don't have a list. They would need to raise their hand, use the raise hand function.
Sure.
If you want to speak.
And Zach, when people do speak, could you ask them to say and spell their names if their name is in any way difficult to understand?
Absolutely. I think it would be helpful for just everyone to do that so that Rachel can get that correct on the record. So.
Yes, and I don't see anyone as having their hands raised.
I don't either.
Sorry to interrupt. This is Amber. Ariel, could you Regina, could you pass me the ball? Actually have a clarification about 2828 that some people might be thinking of, or if nobody's raising their hand, they may not be. But I wanted to, there was in previous discussion about the fiscal note, specifically about 2828. I just wanted to clarify. So let me pull up, let me see if I can figure out how. I'm going to take you back to the 2018 version of this rule. See if I can share. Okay, so this is what it previously looked like, and when it changed in 2019, we essentially took it from this narrative form that you see on your screen to chart form. What changed was the operational policies. We took that piece out and put it in minimum standards, and then we created this self-assessment or the self-study piece, which was for the baseline of 2 points. But what it's always intended, or what it was intended to be, what it was back in 2018 and what was always intended to be, was that it was a point system that sort of grew on itself. So you do the minimum requirement, you get 2 points. Then if you do the minimum requirements plus this other thing, you get 3 points. Or you do the minimum requirement plus something else and you get 4 points. So it's always this thing that sort of built on each other. Like as you can see in each one of these. So 3 points, you have paragraph 1 and then paragraph 2, 4 points. Again, you do paragraph 1 and paragraph 2. So we took this narrative and we put it into chart. And when we did that, unfortunately, it didn't translate over very well into making it clear that in order to get 3 points, you had to meet the standard for 2 points first. So that's what essentially we've gone in and done, is created this language to clarify that. What's interesting and what I wanted to point out was back in 2017, when the fiscal note was, I'm going to use the wrong word, but adopted, I think that's the right word, by you all, it was actually in the fiscal note that it contemplated this system. And I've got to, just so you can see what I'm talking about. So this is the July 2017 note. Oh, I highlighted it. Okay. So you all identified in this fiscal note a new 2 point level requirement, and then you'll need to complete a self-study and self-assessment of the family child care rating scale in order to earn 2 or more points. So I think even back in 2017, when y'all were looking at putting it into this chart assembly, I think you all knew at the time that you meant for you have the minimum or the self-study plus something else to get 3 points, the self-study plus something else to get 4 points, etc. But I think there was some, in case anybody was confused about the discussion last time, and this is the way, to be clear, this is the way that it's being implemented right now, because it was always the division's understanding that the points built on themselves. But having gone back and looked, and we determined that the rule was not clear, which is why we've asked or we've brought it to you all, and y'all have agreed to make this change. But I just wanted to put that out there that that this wasn't anything that we didn't intend this to come out of left field. This was just sort of clarifying what we had been doing all along.
Thank you. You guys have questions for that clarification? Thanks for that, Amber.
Sure.
And Deidre reminded me that we did have a general comment and a public hearing comment in our email as well. So I hope you guys have referenced those two comments that were submitted in writing. One from Denise Purcell and one from Tamika King. So. I'm still not seeing any hands, Deidre. If I'm missing someone, make sure we got plenty of eyes on that. Okay.
I don't see any either.
Okay. Emily, did you have specific questions about the fiscal note? It went out in the package to commissioners.
Well, I don't know if I have specific questions. Thanks, Zach. As much as an overall comment, and I'll start this off by saying I'm the first one to say that more education is better, and the more we raise the profile of our preschool teachers and NC pre-K teachers, et cetera, and so forth in the classroom, the more respect they get and all of that. And I've been here through all of that, and I agree with that. But we also started this meeting with Zach, you talking about the conversations about how to get more people into our workforce. And we've had very recent conversations about challenges in getting people into our workforce. And as I look through this fiscal note, I feel as though, we're saying right here that by adopting this, and if these NC pre-K TAs do not have or are not working on these increased learning goals, that they will lose their job. Now, in this case, as well as many others, I just wonder if this is not a time that we need to talk about keeping as many people as we can in the workforce, as opposed to implementing something that potentially forces people out of the workforce. And I'm not running a center. I don't know what the impact is on everybody's individual centers. It's just, we've had a lot of conversation about keeping people in. So I do wonder if there's a benefit to having a conversation, probably much like you all are having, Zach, of where is the balance, at least for our current circumstances.
I think that's a great question.
There's a lot there. It talks about, potential grants. It talks about things that may happen. It talks about increased payments. You can charge a higher tuition. Question is, will subsidy go up? There's just a lot of ifs, ands, and buts that makes me uncomfortable given the state that I hear from you all of where we are.
I have a comment.
Go ahead, Dr. Foster.
I think that knowledge is power, and we want to make everybody who educates children, and in my case it was parents, to be able to be cutting edge. So I think it's very important, even in stressed times, that our people teaching the youngest children in the first 3 years of life are by far the most important learning experience they get. To be on the cutting edge of learning theory, of child development, etc. I just would want to make it as easy to access as possible. If they can get this certificate, online, taking tests, so you know that they make sure that they've got the knowledge. But I still think it's very important that we offer it. But I want it to be as user-friendly, and I'll be in the focus group tomorrow, and we're going to be addressing quality improvement, and maybe this could be something that they, may bubble up. I don't know.
Any other thoughts?
I'll just say, Dr. Foster, I agree with you. I absolutely agree with you. It's just, where is the balance? Because I know that there are so many child care providers that are struggling to staff their centers. And I don't know. It seems to me that there's a rub, and I just wanted to bring up that for discussion.
I guess the question would be, this is Perry, and I'm agree. I want all the education we can get, and I'm not opposed to this one. However, it does seem obvious to me, I don't care how much education you have, if a child cannot find a child care center to put him into the classroom, that education is doing no one any value. So the fact that we're all so strapped for teachers, and I don't know that this would hurt or help locating teachers. I would think it would probably make it a little bit harder, but that's the challenge. I mean, you can give them all the education you want, but if you can't staff a center, then where are those children getting educated now? At a home, in their neighbor's house, and somebody down the street? So there is some logic and practicality to how to apply that and when to apply it. And I think that's all she's really stating. It's not necessarily something we don't want to do. Is this application time appropriate?
So this is Ioma, and I definitely understand, what's being said about, that we need more education. And yes, but the evidence actually still, that's technically not there. But I think we all agree that more education is always important. But I think we have to think about issues of equity, right, around education access, and then cost of getting an education, cost to maintain, I think, the workforce, as Perry was just articulating. So I think that we have to kind of have a more nuanced conversation about education writ large versus specific courses or supports, than just assuming that more education gets us higher quality, when that's not actually what the literature has actually told us. But we do want a higher quality workforce, so we can demand more compensation, right? So this is the issue of compensation as well. So I do think we should probably be careful, especially in the middle of a pandemic, to require even more things when we haven't fully compensated a workforce that's not even across the board making minimum wage. So I do think we have to kind of have more of a nuanced conversation about some of these standards being requested in addition to what was already requested.
So, Zach, this is Christy. May I mention a few things?
Please.
All right. So, guys, you will remember when we first brought this rule up, and I think Amber's sharing some content. Amber, do you want to start, and then I can add to? Okay. Basically, as you well know, we have had an agreement with the public schools for our NC pre-K classrooms for many years. About half of our programs are in public schools and half are in private child care facilities. And as part of that, there was sort of like a grandfathering in of teacher assistant credentials for the public schools, according to the No Child Left Behind Act, which basically said that those teacher assistants could have work experience and not have any type of education. And that was a different standard than what was required in our private child care facilities. Also, this was one of the things that held us back as our NC pre-K program was evaluated in the NEAR report related to where our entry-level requirements were. So the intent of this change was really just to even the playing field so that what was being required by the private child care was now being required by the public schools. And this was something that I began to work on 3 years ago when I first came on board, because that standard was not equal. And so that's truly what this is. It was not additional requirements that were being put in place. So Amber, I'm not sure if you want to say anything to that, or that was the rationale for this change. It is not adding additional requirements.
Well, now, Christy, the fiscal note says that it is.
Yeah, that's what I.
And I'll just, and I'm going to go to the NEAR report, the 17-18 State Preschool Quality Standards. As I look at it, that would bring us to a total of checking all of 10 of the boxes, and I'm not saying that it's a bad thing.
Right.
As far as, you know, being the best of the best, because we do want to present ourselves as the best of the best. But that means that we just join, there are only 3 other out of 57 that are there. Not saying we shouldn't rise to the top, but right now we're at 8 of the 10, and we're definitely well into the top half, if not further up. So that's why I'm saying is that it's putting us into a very elite category, which is, I understand where we want to be, but to everyone else's point, there's got to be balance at this point. I'm hearing too many people are scrambling to keep classrooms in compliance with ratios and all that other kind of stuff, and quite honestly, to hire teachers. And I don't know if there truly is the data to support to be able to charge more for daycare when we have this. So I hear what you're saying, Christy, but the fiscal note does talk about an impact of additional requirements.
It would be helpful to have greater clarification on that point.
So essentially what this does is it changes the timing. So I'm hoping that you can see the 3013 on your screen. So the old language talks about that a teacher assistant has to have a high school diploma or equivalent and shall hold or be working toward an associate's degree or a child development associate credential. What we did is essentially say you have to have those things prior to. But it was always in rule that they had to have it or we'd be working toward it. Now, so we sort of flipped the timing of it, saying you have to have it. You can't just be working on it. You have to, once you've completed it, then you can.
No, you can still be working toward it, Amber. It says hold or be working toward.
Oh, well then, that's the CDA piece. So we wanted you to have the CDA. For the associate's degree, you can either hold or you can be working toward the associate degree. So where we flipped it was specifically for the CDA. So before you could be working on your CDA, now you actually have to have your CDA.
Or be working toward an associate degree. So they can still be working toward. So there is additional coursework, but again, it is setting a minimum, and this is only for our NC pre-K classrooms. It is not for all child care classrooms, and it's only for the teacher assistant. And we have had, this was something that we had been working on. It really does not change what the child care providers have, because in private sites, they were already either holding or working toward in the requirements. So they still can do that. It gives them another option is if they hold the CDA, then that qualifies them at minimum standards. But they can still be working toward their associate degree, which really does not add any additional requirements for the private site.
And that was the other thing I was going to point out is that this is specifically for NC pre-K teacher assistants. This is not for all providers. I just want to make sure that was clear.
This is Susan. I don't know if it's helpful to also conceptualize, but for those assistants who are working on their 6th semester hours, they're also going to receive credit towards that in-service, towards those 15 hours of in-service. So they kind of are going at the same time, if that makes sense. I don't have off the top of my head, and Christy, maybe you can help me, what 6 hours of coursework would relate to in terms of hours of professional development, if that makes sense. But just to explain that if the requirement is that they're working towards the associate's degree, which is the same as it used to be, that was always in there, that the part about the 15 hours of annual in-service could be addressed by the ongoing education, if that makes sense.
That is correct, Susan. Yes.
And Susan, correct me if I'm wrong. Thank you, Amber and Christy, for that clarification. I think that probably, I'm hoping that brings a lot of clarity to the comments and statements. But Susan, correct me if I'm wrong, but in most of these situations with teachers working on this education, there are ample scholarship opportunities for them. We don't have one teacher in our school that's paying for their education because they qualify for TEACH or STARS. I know our community college system has several scholarship opportunities that not only pay for their education, but in some cases, I don't know if this one still is in existence, Susan, but I know in some cases they're even helping out with stipends for childcare and books and travel and those things. Just wanted to share that. Yeah, that it varies among the different 52, 58, I always get the number wrong, community colleges, but there certainly is, there are a lot of resources at community colleges that I think are untapped, and so that would be certainly something that we could talk to Access about to just make sure that, just in relation to this going out, if it's helpful for the community college system to make that information about what they have available very clear to those in their area who maybe don't know that, that could certainly be something to share. Yes. Thank you.
Anyone else have anything there?
In fact, the only other clarification, this is Christy again, that I would make is, and Rachel can answer this in more depth than I can, but when we do the fiscal note, if there is any way that someone may have to have additional training, that has to be documented in the fiscal note. That does not mean that every single person will, but we have to give the worst case scenario of what it could cost. So that might be why it's a little misleading when you actually read the information from the fiscal note. Rachel, did I say that correctly, or can you add to that? Okay. But I believe that's right. We have to show the worst case scenario because we worked long and hard on how to justify that fiscal note. But again, this still allows private sites to continue to do what they did. The only thing we did is pull out the CDA as something that many people, especially in Head Start especially, already have, and that would make them be at a minimal requirement. But they can still be working toward those courses for an associate degree, which was required already by teacher assistants in a pre-K classroom.
Hey, Christy, this is Deidre. You're correct. We do have to show the worst case scenario.
Okay, thank you, Deidre.
Yeah, thanks for that clarification. All right. We've still got a few minutes here of the public hearing and public comment. I have still not seen any hands, and that's okay. We can further this conversation. But one thing I wanted to bring up that Deidre has pointed out to my attention is that the April meeting that we just scheduled could serve as our fourth quarter meeting if we would like just to go ahead and bump up our May 3rd meeting into one meeting. Now, I understand some people agreed they could do the April 26th because it was going to be a short meeting, and this would then turn it into a longer meeting. But is there any desire for people to go ahead and let's move our May 3rd up to that April 26th date, and then we would not have to come back in May to have another meeting?
Sounds good to me.
And I'll
good to me too.
Okay. I'm getting some more good for me. That works for me.
Zach, this is Kim. It would work for me as well.
Okay. Thank you, Kim.
Works for Sharon.
It works for me as well, Jack. Janie, too.
Thank you, Janie. Thanks, Dr. Foster. Is there anyone it does not work for?
Hi, Zach. It's Melissa. Again, it doesn't work for me, but I would not want to stand in the way of being able to eliminate an extra day. So,
okay.
Get it.
I'm sorry, Melissa, but thank you. Well, let's plan on doing that. And Deidre, thanks for that suggestion. I think I was so lost. I was so lost in dates a while ago that didn't really hit that we were going to be doing it 2 weeks in a row. But that makes a lot of sense. And again, Melissa, I apologize, but thank you for that.
So, what time do you want the public hearing to be? Do you still want it to be early or?
Earlier, yeah, I still would like to get it, and I recognize why we typically do that because of the convenience for people, but I do think with this, while we're doing it virtually, I don't know that the convenience for them having to come to Raleigh is that big of a deal. I would say let's go ahead and do it earlier.
Yeah. Okay.
And then, if there's people to speak, we'll certainly listen to everything they've got to say, and if there's not, we can go ahead and get started with the meeting and like I think today has been helpful. We've taken this 30 minutes to have conversation that would have, otherwise we would have had a 30-minute void here. So this worked out. But yeah, let's go ahead and move it up. Thanks, Deidre.
Okay. This is Rachel. So the May meeting has now been moved up to April 26th. So April 26th will be a fourth quarter meeting. The only difference is adding to the agenda the voting to adopt the rules and physical note. Is that right, Deidre?
Yes.
If you guys are telling me we can do that, that answer is yes, Rachel. Thank you.
Zach, the other thing, in order to be able to do that, Deidre and I, what she pointed out to me, is in order to be able to have that meeting on the 26th, we will have to have a fiscal note ready for you. And in order to have that ready, we probably need some idea of what we would be doing with those temporary rules. So I think this morning what was emailed to you all was a draft, which I'm also going to share. I think this is it. Nope, that was the other one. Hang on just a second. Let me make sure I've got my right thing pulled up.
And the public hearing and public comment period has closed. I'm sorry, Amber, I just need to.
No, I'm happy for you to do the business we're supposed to be doing. So let me share. Stop. Oh, wait. Okay. Can you all see the 3100s?
We can.
Okay. So the underlined language is what I added in my crazy world thinking that if it was something going to be related to COVID, but not necessarily still called COVID-19, if it was a state of emergency. And in my head, I think what's most likely going to happen is that this COVID-19 state of emergency is going to continue, even if we have variants or we have other issues popping up. It's not like we're going to come out of a state of emergency and go back. But in case that we do, the way that I sort of foresaw this was, so this is what's currently written is that during the scope of this, and it is only during the declared state of emergency to coordinate the state's response and protective actions to address coronavirus disease 2019, public health emergency, etc. So that's the declaration of state of emergency that we're in. And what I had proposed was, and any subsequent declared state of emergency arising out of or related to the COVID-19 public health emergency, which affects the operability of North Carolina public schools. You all can leave that out. We can just address COVID-19 and if we, end up in a similar position in 2 years because of some variant or something, we can always come back and do this process again. But I'm still of the opinion, and my advice to my client would be that we would not recommend that this go outside of the scope of this particular public health emergency. But I'm happy for you all to sort of take a look at that. But all I have to say is that we need to have a fiscal note either related to this or something like it ready for you all on April 26th.
That's kind of what I was thinking, Amber. So
okay.
But I'm one person. So does anyone else have thoughts? I mean, I think that'll certainly. You're asking, will this give us the right? Are we headed in the right direction here? Right? Yes. I think so. Everyone else agree?
I agree.
And thank you for that, Amber. Okay. Looks like it seems to work for everyone else. All right. Didn't know if Amber was on the phone. I didn't know if she was saying something. I saw her hand coming up, but anyway. Okay. Well, I don't have anything else. Does anyone else have anything they need to bring forward to the commission today? And if not, just remember we have moved that April meeting and or the May meeting to April. And I appreciate your time today, and let's go continue to make children in North Carolina safe and healthy. So
April 26th, how long is it planned for? From 9 to 1?
Let's go there, Mitchell. The agenda has not been set, but that seems to be what's been working recently. So in this world, who knows what changes between now and April 26th? But yes,
that sounds good.
That seems good for a place marker on your calendar. So, all right. Well, I appreciate everyone's time today. Lots of good work, and again, thanks to everyone that presented today. And we will see you guys soon. So
we need a motion to adjourn.
Goodbye, everyone. Thank you. Take care.
Thank you,
everyone.